good morning, or good afternoon, depending on where you're joining us from. I know you've been waiting to hear some sound. We were yet to begin, but now we are officially beginning at the top of the hour. This session was meant to begin at 11, as you can see on the projection on the screen. This is the second day of the ARIN conference, and we have sessions outlined as follows. But before I go into that, I just want to welcome you warmly to stay tuned for the day. We have 3 sessions ahead of us. So before we begin, I'd just like to just get to feel and to know who is joining us. You can just type your name, your affiliation, or maybe anything that you hope to achieve from these sessions on the chat, and possibly where you are joining us from so that we can know how to reach you and your contacts. If you'd like to connect with other people who are joining here, you may just feel free to just post in your contacts there. So this is going to be a 1-hour session, and then we shall have a 30 minutes break before the second session begins at 12:30. And after that, we're going to have another 30 minutes break now before we go into the main session. So we just urge you to stay with us, stay along so that you may follow the conversations, and hope that even the days that is coming tomorrow, you're going to still be with us. I'd just like to request kindly, if you're not speaking, just ensure that you're muted all through. If you have a question that pops up along the way, just feel free to type it in the chat section. If you want to contribute to the conversation, just have your raised hand and we'll be able to note it down and try the best we can to give you a slot to speak. I can see that we have people that are already typing in the chat. We have someone from, I saw someone at the top. Yes, Dr. Hanan from Sudan. Welcome to the session. Edwin from Amazon Theatrics. Good to see you. Good to see all these great names. I'm seeing Islama from Nigeria, Hannah from Adra Africa, and so on. Please keep introducing yourself. We appreciate you taking time to join us. And we will ensure that to make this session as interesting as possible. So as projected on this slide, and before I go to that, I think just to ensure that we remind ourselves the name of the conference. The 3 days we're aiming to bridge the knowledge gap between climate and health. We want to just delve into the transdisciplinarity between climate and health resilience. The sessions yesterday began the conversation on the issues at hand. Today, we're going to delve in deeper into how to promote the transdisciplinarity, and tomorrow we will go and try and highlight the issue of funding and all that. So just today, this session, we want to look at one of the initiatives here at ARIN that we are undertaking, the Locally Led Adaptation Metrics for Africa. My colleagues will take on that session to just, dissect what is going on in that project initiative. Then the second session, the side event, is going to look at how to promote research excellence and dialogue on meteorological information. And this is going to be hosted by the Ministry of Environment, the Directorate of Climate Change and Forestry. And then the main session, the plenary at 2 p.m., is going to now look at the opportunities for enhancing transdisciplinary climate and health. So that is the outline for the day. I hope you stay tuned and hope to see more of you in the next session. So allow me to hand over to my colleague, Washington, to just introduce the LAMA, the Locally Led Adaptation Metrics for Africa. And yeah, stay tuned. Thank you. Welcome.
Yeah, thank you, Vicky. Distinguished participants, good morning. My name is Washington Kanyangi, and I will be your moderator for this first side event of the day, where we will be exploring opportunities for enhancing transdisciplinary climate and health, with a focus on locally led adaptation for Africa, LAMA in short. So LAMA emphasizes that adaptation metrics should capture adaptive capacity, exposure, vulnerability, and gender disparities in nuanced ways to reflect both regional and local climate risks in respective vulnerable contexts in Africa. This program is being implemented by the Africa Research and Impact Network, ARIN, which is an international think tank with a network of 200 researchers and policymakers. Its presence across Africa has been fostered by our national focal points across 36 African countries that work closely with the Secretariat stationed here in Nairobi. And the network leverages this operational design to convene research, policy platforms on climate action, drawing from perspective of researchers on adaptation, science, technology, and innovation status in Africa. Kindly let me take you through the program for this side event. We will be having our opening remarks from Dr. Humphrey Agevi. This will be followed by a presentation by Ms. Leah Aoko on locally led adaptation and health indicators nexus. She will be supported by Gogo, Mr. Ezekiel Gogo, who will be presenting on data mapping. Thereafter, we will have a session on Q&A, and we will be closing this side event with closing remarks from Ms. Leah Aoko. Before I introduce Dr. Gevi for the open remarks, Dr. Gevi is a research associate at Africa Research and Impact Network, specializing in climate change and development with a focus on resource mobilization and collaborative research. He supports ARIN Press, contributing research papers and policy briefs. Holding a PhD in environmental biology, his interests include biodiversity, climate change, and nature-based solutions. With over 10 years of experience, Dr. Gevi is involved with the Kenya Ecosystem Services Partnerships and other ecological organizations. Dr. Gevi, welcome.
Thank you very much, Washington, for the introduction. Good morning, good afternoon, good evening from where you are joining from. I take this opportunity again to welcome you to this side event on locally led adaptation metrics for Africa. It is indeed wonderful to be with you here, and just from yesterday's engagement, climate change is indeed happening, and Africa has been affected mostly, despite that it is only contributing to only 4% of the greenhouse gas emissions. There have been a number of initiatives that have been put in place just to adapt to climate change. Most funders have come up, including the Global Environmental Facility, the Adaptation Fund, the FCDO, among others, including even NGOs, just trying to bring resources to ensure that communities are able to adapt to the impacts of climate change. What we need to understand that climate change is not only an environmental issue, but it has a profound effect on well-being, on health, and impacting differently to the vulnerable communities, the women, the youth, persons with disabilities, among others. when it comes to these interventions that are being put in place, the question that we need to ask ourselves, are these interventions effective? In a separate project that we have been conducting in East Africa, we were able to find out that when it comes to effectiveness of adaptation interventions, then there is need to assess both the process-based indicators and also the outcome-based indicators. And through that, we are able to know whether an adaptation initiative is effective or not. And moving forward, we need also to understand that the solutions to the global climate change should not only be left to the global organizations, to the national policies. There is need for us to consider the invaluable role that the local communities play in even trying to adapt to the effects of climate change. And this implies we need to look at the local knowledge, the cultural practices. We need also to look at what are some of the grassroots initiatives. And once we look at all these aspects, we are able to know if an adaptation intervention is effective in trying to address the climate change impacts. And in addition to that, also we need to empower the local communities to lead the adaptation efforts. This means that we need to bring in the local leaderships and their role in also trying to improve the aspects of health outcomes among other outcomes that these interventions can impact to the local communities. And we need to understand or ask ourselves, how do we collaborate? And that is the theme of this particular conference, the issue of transdisciplinarity. How do we collaborate between the local actors, between the policymakers, the communities, and when it comes to health, how do we collaborate even with the professionals at the local level? And this collaboration can enable us even collect the local data that is needed to inform evidence, that is needed to even make decisions that are relevant when it comes to climate change. This particular side event is really going to employ and just showcase how ARIN has been implementing the locally led adaptation metrics for Africa, how it has been using the communities, how it has been adopting the bottom-up approach in trying to look at how do we measure the impact of or the effectiveness of climate change adaptation using the metrics and indicators. Thank you very much, and stay tuned even as we listen to how this project has been impactful to the ground. Thank you.
Thank you, Dr. Gavi, for those insightful remarks, and indeed engaging local community as well as the local government is key towards achieving effective adaptation outcomes and resilient health systems amidst the impact of climate change. Thank you. Moving on, we are going to have our presentation from Ms. Leah Aoko and Mr. Ezekiel Gogo. Leah Aoko is a research associate at ARIN and lead project manager on the LAMA project, focusing on science policy integration that builds resilience in vulnerable communities. He has contributed to projects like the Adaptation Resilience Alliance on locally led adaptation in Mukuru, Nairobi, and the Tomorrow Cities project on urban disaster risk mitigation. Mr. Gogo is a research assistant at ARIN, specializing in GIS, remote sensing, data analysis, and IT. He manages ARIN's website, oversees data, and supports climate and health projects across Africa. At this juncture, I welcome Ms. Leah Alcotieno. Welcome, Leah.
All right. Greetings from the Africa Research and Impact Network. I will be making a presentation on exploring the nexus between locally led adaptation and health indicators. So as many of you may know, what we have been doing through the LAMA project, that is the Locally Led Adaptation Metrics for Africa, is to try to profile bottom-up metrics from the local communities, engaging the vulnerable social groups in looking at how their priorities are reflected at the county level, at the national level, and how this discussion can then be replicated at the global space. So what we are aiming to do through LAMA, and perhaps this is an aspect that we're going to deeply dive into in the next slide, is to just look at these adaptation priorities from the local communities, are they in tandem or in line with what is contained in county development plans, in national adaptation plans? Who is being left behind in the conversation? Who has to join the table when you're talking about locally led adaptation interventions, to ensure that they are needs-driven, and where there are funding or resources, these are channeled to the right interventions that will increase the resilience of local communities. So as we reflect on the climate change and health nexus that we had begun talking about yesterday, today we are just going to look at how this then feeds into the locally led adaptation discourse. And here, when we talk about LLA in health, we are basically referring to empowering local communities to design and implement adaptation strategies that respond to specific health risks, which we are going to explore later on in the presentation. And this approach is basically what LAMA is using to recognize that local actors, such as community organizations, vulnerable groups, local governments, understand their unique challenges and resources at best. We are giving them an opportunity to shape the agenda at the county level and at the national level to ensure that their needs are being met. Adaptation measures can be more relevant to them, culturally appropriate, and foster local leadership. So we are going to be having these vulnerable groups leading the process and not us lording over them, to ensure that ultimately there's health resilience amongst other facets of locally led adaptation. So just to summarize a bit of the locally led adaptation metrics for Africa, its aims and specific objectives, we are intending to support measurement and reporting on the relevance and effectiveness of locally led adaptation. Now, this is to say that we recognize the challenges that will attend this process. Very few organizations or programs have really ventured to look at the effectiveness, or they do not know the indicators that would then point to an effectiveness of an intervention in locally led adaptation when you look at the health sector. So we are ambitiously attempting to do this through strengthening the inclusion of local adaptation priorities. And this I've said, we recognized that vulnerable groups, their voices are often left out when these glorious county plans or policies are being developed, and hence the interventions do not necessarily increase their resilience. So we want to bring this at the fore of the discussion when we are talking about marginalized groups. So just to look at the specific objectives, of course, to identify priority adaptation needs and aspirations of vulnerable groups. And when we say vulnerable groups, the LAMA project, or the Locally Led Adaptation Metrics for Africa project, is going to focus on the women, the children, child-headed households, the elderly, persons with disability, amongst other intersecting vulnerabilities at the Lake region. So although it's based at the Lake region, we intend that the lessons we are going to be learning be elevated or be escalated to the national level conversations and inform global policy aspects as well. So we also want to understand the progress that has been made in capturing their needs, any assessment that has been worked on by the community-based organizations, or rather to adopt approaches that can be used to capture these needs, identify metrics that will capture the aspirations of vulnerable communities. So this is effectively bringing them to the table so that they're able to own the process to determine whether certain interventions are increasing their resilience in the health sector amongst other sectors that are involved in adaptation interventions, and then aligning these metrics to national processes. So basically presenting this to the policymakers and telling them, these are our findings, or this is what the community really prioritizes when it comes to adaptation, and this is what success looks like for them. This is what effectiveness looks like for them. These are the indicators that have been co-created by vulnerable groups, and how can then this be used to be incorporated in national adaptation plans and processes. So this correlates to the research questions. I may not belabor that much. So just to scope out some of the health indicators in locally led adaptation that we are looking at the Lake region in Kenya, where this project is being implemented. These health indicators are really focusing on metrics that directly reflect the impacts of climate change on community health, enabling communities to track and adapt to these changes effectively. One of these include heat-related illnesses, frequency of heat stroke, heat exhaustion, and dehydration. We know that in certain parts of Kenya, including the Lake region, they have experienced prolonged seasons of where there is no rain, and hence there are a lot of heat exhaustion cases and dehydration cases. Waterborne diseases whenever there is flooding. I think this is not just limited to the Lake region, but also the country as well, and other parts of Africa that have witnessed these effects whenever there are cases of flooding. This is where communities, through these indicator communities monitor incidences of waterborne diseases. How many cases have been reported is what you're looking at, whether it's cholera, diarrhea, or typhoid, amongst other waterborne illnesses, which are often linked to flooding and contamination. We're also going to be looking at vector-borne diseases. How many have been reported? How is the spread of the disease like? So here we can only track through the cases that have been handled at the health centers or local community health workers. And then these include malaria, dengue, that is very common at the coast region, Lyme disease, that is common in other parts of Africa. And also respiratory illnesses. This points to air quality indicators that we are also scoping out, which are critical for tracking respiratory issues such as asthma, bronchitis, and allergies. And this will form part of the research work that we'll be doing at the ground level with the vulnerable communities. Additionally, we have nutritional status, cases of malnutrition that are rampant due to food insecurity. We're going to look at how the impact of climate change has disrupted food security processes through droughts, crop failures, or increased food prices. We'll be looking at indicators such as childhood stunting, wasting, anemia rates, etc. Mental health metrics. And this just to point out that through our previous conversations that we've had with partners as well as policymakers, mental health is one of those aspects that has really come to the fore as being neglected. But here through LAMA, we are going to be exploring indicators of mental health issues, such as persons affected by depression, anxiety, stress-related illnesses that are increasingly becoming relevant as the impacts of climate change intensifies. Access to health services, where we're looking at how many facilities are accessible, availability of medications, frequency of health service disruptions as a result of the impacts of climate change is also going to be critical. Injury and mortality rates from extreme events. We are very well aware of this, being from the global south, and perhaps other participants from other areas can attest to this. Tracking injuries and fatalities resulting from events such as floods, storms, and wildfires would be important as we explore the effectiveness of locally led adaptation interventions, as well as sanitation and hygiene. So access to clean water, sanitation facilities. And this just to point out that these indicators, as we have scoped them at the county level, are going to be put into better context through a data mapping analysis that my colleague, Mr. Gogo, is going to be presenting after this. So just to look at what are some of the locally led adaptation and health initiatives in Africa that are inspiring the work that we are doing through LAMA project. One is the community-based malaria prevention in Kenya. And this, I don't think I need to belabor the impact, the devastating impacts of malaria, not only in Kenya, but across Africa. And here in Western Africa, work that is being, we are inspired by is through an initiative to reduce malaria transmission by promoting the use of bed nets, which has been undertaken by the Ministry of Health at the county level, improving drainage systems, which is usually community-led through their own initiative to reduce mosquito breeding sites. We have trained local health workers in most health centers in Western Kenya, which has malaria prevalence. Residents collaborate on monitoring malaria cases and providing timely information that is always available through pamphlets or information sharing sessions. Another work that inspires us is in Africa from an Afrocentric perspective is water harvesting techniques in Ethiopia and Sudan. We know that these are two countries that are often heavily impacted by flooding. And so what has been adopted in Ethiopia, not the whole, but just a brief scoping, is water harvesting systems such as rainwater catchments to secure water for drinking, agriculture, sanitation in Sudan, etc. And these systems have been managed or maintained by local leaders. So you do realize that in as much as that these interventions, they really have to be led or to be led at the front by the local community for them to be effective. We have farmer-managed natural regeneration in Niger, and this we scoped out because it is particularly relevant to the locally led adaptation metrics for Africa project. And here in Niger, West Africa, we have communities practicing farmer-managed natural regeneration. And this approach improves soil health, enhances agricultural productivity, hence leading to food security and better health for vulnerable populations such as children. Then I think finally we have flood resilience initiatives in Mozambique, again in Southern Africa, that is particularly vulnerable to flooding incidences, which exacerbates health-related issues such as cholera and malaria, health impacts. So here again, local leaders taking that initiative to collaborate on flood preparedness and response programs, including early warning systems, evacuation plans, etc. So being led by the communities as well, just emphasizing the need of their involvement from the bottom-up approach that LAMA is trying to do. Probably the very last example is the drought-resistant crops programs in Zimbabwe. We know last year Zimbabwe was affected by a Hurricane Freddy, and so this led to a lot of displacement amongst other challenges. They've also been faced by drought, and one of the programs that are being promoted is through the use of drought-resistant crops. Again, an example in Tanzania, the use of indigenous knowledge, and which we will also incorporate through the LAMA project as we scope out health indicators amongst other aspects, because this is essential in strengthening immunity at the community level, recognizing that indigenous knowledge is a valuable adaptation resource, which we do not capture enough through our research and our work in the adaptation space. So here we have local health programs that encourage cultivation of medicinal plants and trains younger generations so that there's that passage of knowledge to them in strengthening community resilience. mental health aspects that have been supported in Nigeria. We had quite an example on this, again, being led by local NGOs. Here in Kenya, we have many community-based organizations to offer mental health programs that are culturally appropriate and trauma-informed, but to people who have been devastatingly impacted by climate change. And this then goes to supporting their mental health in various communities. So here we have community gatherings, we have traditional healing practices to relieve climate-related mental health stressors, which is very important, not only in Nigeria, but also in other parts of Africa. So what are we trying to say in conclusion? We are saying that one, what we are discovering from our scoping analysis through the locally led adaptation metrics for Africa is that health indicators are essential because they help communities, vulnerable communities, to measure, track, and respond to the impacts of climate change on health. This emphasizes the importance of community knowledge, capacity building, leadership in addressing climate risks, so that then these indicators are relevant, accessible to donors, to funders, to governments, to policy makers, and understandable to these communities, because they'll have co-created the indicators, which is a huge plus and a novel approach that we are using through LAMA. And then we also recognize that by using locally relevant health indicators, communities can prioritize health interventions that directly address climate-related issues. So whether it's air quality, respiratory issues, etc., they can be empowered or capacity built to address these as it relates to their health. And then finally, that through locally led adaptation, communities can concretize their metrics to support their experiences, empower them in decision-making processes whenever their public participation, insights, meetings that have been called for them to provide their insights to the policymakers or to other leaders. They are able to do so from a point of evidence, and they're able to use the relevant data-driven insights to improve local advocacy efforts, to enhance funding applications, and ensure that adaptation policies align with the actual community health needs. And so we are curious from the Africa Research and Impact Network. From this presentation, we are curious to know what are some of the locally led adaptation health-related initiatives you are working on with the local communities. I think we'll give you an opportunity to answer this through the plenary Q&A. And also we want to know, how can we ensure that these initiatives remain needs-driven for vulnerable communities impacted by climate change? As I've said, it's a novel approach that we're using where we want to scope out these indicators, but we really want to learn from other work that is being done across Africa or wherever you're situated on how you're ensuring that you are measuring these initiatives to remain needs-driven and relevant for vulnerable communities. I'll stop here and quickly invite my co-presenter, Gogo, to just place this into data perspective. ARIN is about evidence sharing, so we want to present the data work that we have done so far in relation to this topic, amongst others. So I'll invite Gogo to just share his screen and wrap up that discussion. Thank you.
Good morning, good afternoon once again, and thanks for joining us. I'm just joining from where my colleague has left so that I can able to put context into the data perspective on where we are in terms of LAMA. We just want to bring the picture so that we can able to see in terms of data-wise, what are we talking about when we are talking about the nexus on LAMA and the health initiatives or health indicators. So these are some of the data preparations that we took into concern when talking to enable us to bring this into perspective. There are many various data sources, including elevation data, that we're able to see how highness of a place is from with respect to the sea level. the water catchment areas that also put into perspective on what Lea was talking about when you're talking about waterborne diseases, how an area is flood prone depending on how closeness or far they are from the catchment area. The transportation data, these are including roads that we're able to see the health access services, either how far the communities or the vulnerable groups are from the health centers. The land use and the land cover, which highlights the land practices and the demographics that shows in time what is the changes on the land that these communities reside on, and how these changes help in shaping the climate change, and also some of the health impacts that arise as a result of that change. Climatic data that is most importantly from remote sensing images and satellite images, such as the temperature and rainfall patterns. Temperature will help initiate, even look at the heat index patterns, so that when we are talking about heat-related diseases, or how is the temperature on that area relating to that? Is it attributed to high temperature or not? The rainfall patterns that also attribute to flooding and also help the communities in flooding, and also the drought, if the rainfall are missing, if the rainfall has been scanted or erratic as part of climate change has been attributing to this. And also the last part of the data preparation will be the sample data from the county and the national government to see how the co-creation has been done from top-down approach, and how LAMA is bringing the bottom-up approach to see the relation and how this can help in defining. So these are some of the maps that help us understand the area. Of course, LAMA is focusing on the local, on the LREB region, which is 14 counties just on the western part of Kenya. But of course, as my colleagues say, the findings here and all the data that have been used here can be used in scaling up this to be used in the whole of Kenya, and even can go to global, because these data sets are from the local level towards the global nature. So the map on the right just explains how high an area is, and the redder part of the map shows the highness. You can see the top part at Trans Nzoia, where Mount Elgon is. That shows the higher altitudes, and towards the Lake Victoria, that's where we have the lower area. So this just gives us a feel of how is the terrain of this area that we're looking for. The map on the right is the catchment areas and how the major rivers are flowing into the lake, and the other catchment areas that include the streams or the drainage patterns. So this is also important also as well to see the flooding cases or anything that may be attributed to that. Sorry, last map that I'm going to display is the road network again. This just attributes how the region is interconnected, especially according to road network. This also, on this you can superimpose the health centers where they are located to see the proximity and how people can access the health services, or how close they are to them. Whenever there's an outbreak, how quickly can they be reached, or how far are they to be able to mitigate this. So the next slide is just showing, I'm going to focus in on the county climate change action plans that we're able to look into detail in respective to our area of study. And so far, what we can able to see is for each county we have various sectors that were priority in coming up with the county climate change action plans, and if you look closely, you might see that some counties have health sector engraved in them, and we're able to interrogate that into detail. And the lower part just give us the total number of indicators for the sector on the county. And this is as a reference to the 14 counties. And this is what, this helps us in now when you are going to create with the community, which is the next step of the LAMA project, we're able to compare this data from the county and the ones that we are getting from the local and the vulnerable groups. When you get there, how different this will be and how what areas are they prioritizing that is different from the county action plans. So this is just going into in depth on the various sectors that the county was putting in place, and the legend is on the right showing our area for the 14 counties and the number of indicators per sectors. And from this, you can see Trans Nzoia has the largest number of indicators. Trans Nzoia County about over 140, Trans Nzoia and Kisumu, with the least one having the indicators being in Vihiga. So again, we can dive deeply to see what is the nexus of health in this case, and see how does health indicators being talked into when it comes to the county perspective before even go to the vulnerable groups to help in co-creating this. So just to zoom in on the health sector, as to find the transdisciplinarity, from the 14 counties on the left, you can see only 5 were able to incorporate the health sector in their action plans, and this is Kakamega, Kisii, Kisumu, Migori, and Trans Nzoia. What I'm going to say is this action plans change as it's a continuous process from the county, so it's not engraved that the other counties do not talk about health indicators as well. So this is just according to this current action plan here. So if we dive deeper into the respective counties, we're able to see what are some of the indicators that come out when you talk about the health sector. And this is unanimously across the sector. So I'll just go into this to show one, for example, Kakamega. So when they talk about the health sector, what are some of the indicators that they have in mind when they have this question in sight? And this helps in when you're actually going to the ground to collect data or to help to do co-creation with the vulnerable groups. They may increase this list or do away with some that are not working, because remember, we are concentrating or looking forward to having a bottom-up approach, so that we can able to cement and have this comparison from the bottom-up and the top-down approach to see if these are really the interventions that the vulnerable groups are really looking into, so that this can able to speak out when it comes to the health sector. So some of the indicators that came out from the county action plans are the ones highlighted: number of malaria incidences, for example, number of reported incidences of flooding, number of sensitive awareness on climate health risk, and proper solid waste, and among the rest. So this again, if I'm going to embed this with what Leah was talking about in terms of the health indicators case studies. When we talk about waterborne diseases, we can able to do a disease map per hotspot, so that this can communicate well, so that when such indicators are being measured, and the communities are they're the first at the forefront of experiencing this, and that brings the nature of being at the forefront in co-creating this, so that we can be able to get their views and use those views to interrogate actually what has been happening from the top down, and if those interventions are really working and can be incorporated and co-created. So this again will help in reaching the conclusions that Leah has really highlighted into detail. And I'll beg to stop there. And this is an ongoing work, and these are some of the outputs that we are going to get from this. Thank you very much.
Thank you, Leah Auko and Mr. Ezekiel Gogo for that insightful presentation. One key takeaway that I have picked from the presentation is that locally led adaptation, in health strengthens community resilience against climate impacts through empowering local actors to address specific health risks with contextual appropriate solutions. And again, locally led adaptation can significantly boost health resilience by enabling communities to use their unique knowledge and resources to counter climate change health impacts, and therefore tailoring strategies to local conditions, making these efforts relevant in respective community contexts across Africa, is believed to be an effective approach in tackling climate-related health issues. Distinguished participants, there were two prompts that Ms. Leah Auko asked you. Maybe if you can just give us your thoughts into what you think about some of the locally led health-related initiatives you are working on with the local communities. The other prompt from Ms. Leah was with regards to how can we ensure these initiatives, remain needs-driven for vulnerable communities impacted by climate change. Even as we think about these two prompts, kindly please feel free to just raise your hand. My colleagues will assist you in helping you to ask your question. Even as we wait for our distinguished participants to ask their questions, there are two questions in the comment, and I will quickly, just read them out. So from Samuel Jinandu, asked, could you just delve a little more into the mental health work that you mentioned in Nigeria? So maybe I think in the context of indicators and dynamics, as well as discourses in climate change and health impacts therein. Henry Opondo inquires whether if there is any financing for LAMA, and if not, how can this be mainstreamed into the financing for locally led climate action, FLOCA? Leah, any quick thoughts? Gogo, any quick thoughts for the first two questions?
Absolutely. I was trying to sort of answer those in the chats as well. But there is funding, as mentioned by my colleagues. LAMA is funded by the IDRC together with the government of Netherlands. So we are implementing this in the Lake region. 3 counties in the Lake region. We do not have funding to upscale this to other counties, but we are very intentional because the Africa Research and Impact Network is all about impact and evidence and how this assists the vulnerable communities. So we are very intentional on sharing our lessons and opportunities for implementation in other counties as well. We are working very closely with the Financing Locally Led Adaptation Program, FLOCA, in Kenya, because what we realized is that they have the funding, adaptation funding, but they do not necessarily know from an evidence perspective where this can go to and how it can be needs-driven for vulnerable communities. So we are working closely with them. We even have them as part of our advisory board in the LAMA project so that we can give them the evidence that these are the priority needs for vulnerable communities, and these are the relevant interventions that they say would increase their resilience. The other question on mental health, I think this was just an inspirational work that was undertaken in Nigeria, a place that is heavily impacted by flooding incidences. And I can correlate this to the Western region, where we had a community engagement with young people, and they were able to bring this up as well, as to how climate change impacts their mental health, which is an area that is often overlooked, but it increases anxiety, stress, depression, and we want this to be part of the health indicators that we are going to be scoping out in the LREB region as part of the LAMA project. So yes, we are deeply inspired by the Pan-African interventions that are going around, but also using examples from the Kenyan context to just look at how that remains relevant for us and how that can inspire ongoing work elsewhere. Just a quick response to those. Over to you, Washington.
Yeah, thank you. Thanks so much. A quick question from Dr. Hanan. Kindly unmute and just go ahead, please.
Yeah. Assalamu alaikum. Thanks, ARIN, for the invitation, and thanks, Leah, for this brilliant efforts and this presentation, which is very seems very complimentary, and it needs, it's like a holistic approach, targeting all the aspects. Well, what we need really. Just I have a question regarding the communities and the local communities. Have been provided with such surveillance for detecting, or devices for detecting maybe the situation on the land, rather than raising awareness? I mean, in such a term of training, something like that. And the second question may be, when did this project has been started, especially in the region targeted, as you mentioned? Thank you so much. Thank you. Thanks, Ari.
I don't know if Agavi, you're able to take that in response. Maybe I'll answer the last aspect. LAMA began last year. So we are in our second year of implementation, and it's a 4-year project. We are implementing it in Kenya with possible replication in West Africa. But we really want this not only to be limited to the 2 regions, but to be a Pan-African African-owned to profile adaptation metrics, which is a but a novel aspect that we're looking at. We really want adaptation financing from the Global South to be strategic, needs-driven for vulnerable populations, rather than donor-driven, for example, or organization-based. We want vulnerable communities to be at the table and for this. I don't know if Agavi, you want to comment on the community engagement and how we are doing that. Thanks.
I will come in on that, on the community engagement and the aspects. There was a training that was done for enumerators, that is preparing them to help in getting this co-creation to be done. At the same time, we are developing a questionnaire tool that will help the enumerators as well in getting this data. And the questionnaire tool actually takes an aspect on some of the communities' belief and even knowledge, so that we're able to ask the right questions. And sometimes when you go into data collection without getting the data ethics right, you might not able to get collection in a proper manner. But that is being undertaken in the questionnaire that is being designed. So maybe if Dr. Agavi wants to add something.
Yeah, thank you. I think Gogo has responded. The issue of the enumerators or data collectors, that will be very crucial for this. Already, we have begun the training. We have done the first training just for the enumerators to get familiarized with climate change. So the second one that is coming in is now training them how to use the tools that we intend to use in the data collection. One of them, of course, will be the questionnaires. And number 2, the way Gogo presented there, the issue of the data that will be needed in terms of the road networks, the land use, land cover. Because these enumerators are being derived from these counties within the communities, we shall also be able to use the expertise amongst those enumerators, those that have expertise in GIS and remote sensing. Perhaps we shall just build their capacities and use them to get this data that we shall be able to maybe then extrapolate and know the aspect of broad network among others that need the GIS and remote sensing technology. Thank you.
Thank you, Gogo, Lea, and Dr. Gevi, for giving feedback to those questions. It has been an exciting and informative Q&A session, and I will just move to our last agenda, and that is the closing remarks and way forward from our colleague, Mr. Charles Tonui. Kindly go ahead.
Yes, thank you, distinguished participants, and also the team from the ARIN Secretariat for facilitating the first session. So without repeating what they've said, and the question around especially the indicators for adaptation, especially the locally led adaptation, is actually a debate that has picked momentum in terms of the indicators that we have so far. They are more focused on conventional development agenda than the projects like the Locally Led Adaptation Metrics for Africa is asking the question, where are the indicators from the most vulnerable communities? And that has been a debate also and discussions under the UNFCCC, that's the United Nations Framework Convention on Climate Change at the Conference of Peace. So the UNFCCC, that is the United Nations Framework Convention on Climate Change, through the chairs of the groups, the SABSTA and the SPI, that is the subsidiary bodies, at the 60th SPI, requested the chairs to facilitate the mapping of the indicators at the global level. And why? The COP28, there was a very key momentum which was achieved in terms of what are the relevant indicators that can be used to measure the global goal on adaptation under the Paris Climate Change Agreement. But again, the question was, where are the most vulnerable, where this agreement should be really addressing? And while other actors were already looking at the global indicators, and then other teams were already looking at the locally led indicators, and Gogo has actually presented some of the work that you have been doing, and other actors are looking at the bottom-up processes in addition to the top-down processes. So the 60th session, the SABSTA SPI requested their chairs to prepare, with the support of the Secretariat, in collaboration with the relevant United Nations organizations and specialized agencies with contributions from constituted bodies, a compilation and mapping of existing indicators relevant to measuring progress towards the targets referred to in paragraph 910 of decision 2 CMA 5. That means really looking at the indicators relevant to vulnerability, adaptive capacity, among others. And so the Secretariat started now requesting the global community to submit the indicators, and the first indicators, they were close to 9,000, and ARIN, Africa Research and Impact Network, got the opportunity to be nominated by the African Group of Negotiators and also the UNFCCC Secretariat to join the international expert group. And ARIN was co-leading the work on mapping, reviewing the indicators, focusing on food and agriculture, and also linked to other sectors. So the work started, and so far, what the group, the global level, have submitted so far, they defined by removing the duplicate indicators, they are close to now to 6,000 plus. But what does this one mean? And the discussions that we had was, where are the source of indicators, data and also indicators that are really relevant to the local communities. And that's still a huge gap in terms of the metadata and also the indicators that can really respond to the adaptation needs, particularly the locally led adaptation at the local level. So the conversation, which is now going towards COP29, is indicators that we have so far, and then presenting that it will address the adaptation needs in terms of from the indicators which can support planning, which can support implementation, and also financing, because we normally get the risk of talking about the climate finance without really looking at which indicators can really help us in terms of planning and also developing programs which are fundable and bankable, and also leveraging, not only leveraging, but also triggering the mobilization, the acceleration of mobilization of climate finance and leveraging to the real target areas. And that is one of the conversations that will start also pick up at COP29 and then towards COP30, whereby now we'll be really concluding in terms of looking at the progress, looking at the indicators and the progress to measure the progress now of the global goal on adaptation. The last point is the work that Kogo and the team have presented is around the data gaps. What platforms do we have so far? What are the tools and the approaches that can really be able to really amplify the voice of the farmers, the small-scale farmers, and also the vulnerable communities and the vulnerable groups, the people with disabilities in the different agroecological zones across the globe? And for me, I've interacted and the team close to 719, especially focusing on climate risk assessment. But then again, have these tools gone beyond the piloting phase? Have they gone beyond the project period? Because implementation of programs in developing countries, particularly Africa, are largely donor funded. And remember also, the implementation of adaptation strategies will be relying on the commitments under the Paris Agreement that developed countries need to remit 100 billion per year. And also the next question is, how much are we absorbing based on the submitted or monies, the resources, finances which have been mobilized, technology, the capacity support? So the dashboard that LAMA is already developing and initiating is actually likely to really trigger another conversation in terms of how much in terms of indicators should we really be compiling? How should they be presented in a very interactive way? Are they really triggering or accelerating resource mobilization and also leveraging to really the actual areas? And then also lastly is in terms of how do we capture the lessons in a way that really can present or amplify the voices of these vulnerable communities? And this one comes to the capacity, especially in our African context, our really writing our stories, really compiling our data, and really presenting in a way that we will be able to really be concrete and say we are amplifying the voices of the local communities and the vulnerable communities is still quite low. And ARIN, through its network now, you look at ARIN, how it's taken the initiative in terms of really identifying the champions across Africa and the regional focal points who will be able to really bring out the voices and also the data questions and also the policy issues at the national level. And lastly is really ARIN as a network also, and other networks. We are really calling upon each actor, researchers, the farmer groups, to really come together so that you can be able now to concretize and then move to action in terms of really concretizing the indicators that can really address, like for instance, the Kenya government of Kenya is focusing on what you call the bottom-up economic transformation program. How can those programs at the government level also be implemented effectively in a way that will not constrain the resources that we have or really drive the continent into more debt, but at least really take advantage of the human resource, the natural resources, and really facilitate the locally led adaptation in our context. So thank you so much, and we look forward to really interact with you more, especially towards COP29, and then also towards COP30, which is going to be very interesting and also very engaging in terms of we need more expertise also in data analysis. Yeah, I almost forgot that because that was the conversation we were having among the international expert group, which was supporting the SP chairs when we were reviewing the indicators. Thank you so much.
Thank you, Charles, for that insightful closing remarks. And indeed, capturing lessons, devising innovative ways in capturing lessons to amplify the voices of the local communities is key in building their resilience against the impacts of climate change and health. At this juncture, I will pass it on to my colleague, Victoria. Victoria.
Yeah, thank you, Washington. Thank you, colleagues, for taking on this session. Very insightful. And most importantly, just to thank you all the participants for staying tuned and for interaction through the chat, through just commenting and all that. We intend not to close this link because it's the same link we're using for the other session. The next session will begin at 12:30 East Africa time. So just 30 minutes or less from now. So we'll keep this line on. Feel free to not leave, or you may leave and just join back. We shall have just some playing in the background and waiting for the next session. So the next session, just to remind you, is hosted by the Institute for Meteorological Training and Research, and it's going to really delve into promoting research excellence and dialogue on meteorological information to practices in Kenya. So thank you all, and see you in the next session.
Thanks, Vicky. Maybe we can take a photo. I don't know if you can take a quick screenshot.
Yeah.
We can just have our videos on. Washington, you can assist us in taking a photo.
You can unpin actually. So
great to see everyone. Really great to see everyone.
Someone needs to unpin there. Oh, the one who's the screen is there.
Really great to see everyone.
Just a second.
Just have our videos on for a
one last one, please. One last one. Yeah, thank you.
All right, thank you all.
Thank you.
Thank you.
Yeah, okay, have a good day. Thank you.
My name is Johannes Atela. I'm the director of the Africa Research and Impact Network. On this particular moment, and on behalf of the Africa Research and Impact Network, I want to invite you to register for the ARIN 4th Annual International Conference, which will be focusing on spaces for building transdisciplinary research in action in climate change and health. So the 4th ARIN Annual International Conference focusing on climate change and health will take place from the 6th to 8th of November 2024. I want to call upon all the stakeholders, the researchers, the policymakers, our global partners, our donors, our community partners at the grassroots to join us in this very important event so that we can share ideas, we can share experiences, and we can come together to be able to design or converse or strategize on the way forward on addressing this challenge of climate change and health. We have many opportunities for you. We have opportunities for scientific papers, research papers that are tackling the aspect of climate change and health. We have side events where we will allow different organizations, different agencies to be able to share what they are doing, their experiences, the programs they are running, the projects they are doing in terms of addressing the issue of climate change and health. For more information, please visit the ARIN website on www.arinafrica.org.
Hello there, my name is Aurelia King and I'm the Program Manager in charge of the ARIN Africa Science Policy Fellowship Program. ARIN will host the Africa Science Policy Fellows Assembly this year on November 7th. The assembly will focus on 1, reflecting on the current state of evidence-informed decision-making in Africa, 2, sharing case studies of successful and unsuccessful approaches, 3, identifying a united front for strengthening science policy linkages, and 4, launching a state of the evidence report based on empirical experiences from different countries. This year's assembly aims to build and convene a cadre of science policy influencers throughout Africa who can guarantee that locally driven research and development will have a favorable effect on our societies and economies. In preparation for this year's assembly, fellows will receive mini-grants to conduct case studies within their respective countries. These studies will be consolidated into a book which will be published by Taylor and Francis. These case studies will be synthesized into evidence briefs. The overall aim is to inform long-term planning for climate change issues in Africa, emphasizing critical linkages to equity in climate action and the general well-being of vulnerable groups like the youth, women, children, and other marginalized communities. By analyzing existing evidence, sensitizing policymakers to its values, and documenting experiences and lessons learned, this assembly will ultimately strengthen the foundation for knowledge and practice across Africa. Come join us. Thank you. Hello there, my name is Aurelia King and I'm the Program Manager in charge of the ARIN Africa Science Policy Fellowship Program. ARIN will host the Africa Science Policy Fellows Assembly this year on November 7th. The assembly will focus on 1, reflecting on the current state of evidence-informed decision-making in Africa, 2, sharing case studies of successful and unsuccessful approaches, 3, identifying a united front for strengthening science policy linkages, and 4, launching a state of the evidence report based on empirical experiences from different countries. This year's assembly aims to build and convene a cadre of science policy influencers throughout Africa who can guarantee that locally driven
as well as practitioners in exploring that role of the meteorological and climatological data. And we'll see this from how this has panned out from experience with our colleagues. I can only see Margaret, Augustine, and Josephat. I don't know whether, Margaret, are you sure whether, or can you confirm whether Rosalie and James are with us before I hand it over?
Yes, I'm James. I'm present and I'm hearing you loud and clear, madam.
Good, good. Welcome, James. Yes, I couldn't see your name, but yeah, good. Happy that you're here. Rosalie was meant to, or Pamela was meant to kind of introduce the role you play at your institute and what you do in terms of the research and dialogue, bridging that gap. And I think maybe we can just hand over to you, James, to kind of just give that overview so that we can begin the conversation from there. So let me hand over to you, James, and welcome.
Thank you, madam. But our moderator from this side is Dr. Augustine. Can you, Augustine, go ahead, please?
Yeah, thank you so much, James, for that. And also thank you also for welcoming us into this session, the side event for the ARIN conference. So today we're going to discuss more of like the interdisciplinary connections between climate and health. And we've got our team here. We've got Dr. Margaret Kimani. We've got James Kadura and Lucas Okach, if he's in, and then we've got James. So basically, not sure whether I can be able to like give a round of introduction from the team from Kenya Meteorological Department, Ministry of Environment and Climate Change Forestry. So I hand over to James for an introduction, and then followed by Dr. Margaret Kimani, and then next should be Okach and Josephat. Over to you, James. James, this is introduction. We're trying to introduce ourselves.
What I'm saying, thank you very much, Dr. Kiptum. I'm James Kadura, Deputy Principal, IMTR.
Thank you so much. Dr. Margaret, a researcher and also a trainer at the Institute of Meteorological Training and Research. And I also am Curriculum Assistant Director. Thank you.
Thank you, Dr. Margaret. Josephat, if you're in. Or Okach, to save our time. Okay.
Peter Etabu is my name, and I'm the Executive Director of Cheshire Services Uganda. I'm based in Kampala. Thank you.
Sorry, Peter, we're making introduction from Kenya Meteorological Department because this session is meant to be panelists from Kenya Met Department doing a presentation under this session. So, but thank you so much. Over to you, Josephat and Lucas, to finalize.
I'm Josephat Kangeve. I'm from Institute for Meteorological Training and Research. I am a trainer. I do the curriculum, and I also doing the competency-based training. And I've also worked with the public awareness and public outreach for the meteorological department.
Thank you, Josephat. Okachi is in. Lucas Okachi. Okay, maybe he's yet to join us. So my name is Dr. Augustine Kiptum. I'm a climate scientist at Institute of Meteorological Training and Research, Kenya Meteorological Department. So we support research and development with the team that are in this panel today. So I'm sitting in for Dr. Dr. Pamela Kaithuru, who is not in today to moderate this session. So to begin us with, I'll begin like some few introductory remarks, and then the next phase of this discussion should be like adding over to the panelists for this session. But before then, after I finish, I'll have to hand over to James Kadura to take us through the keynote question. So, so once again, welcome, ladies and gentlemen, to this session. Good afternoon, everyone, from wherever you are joining us. And it's a great pleasure to welcome you to this important session where we will be exploring how transdisciplinary research can strengthen climate and health resilience across Africa by taking advantage of diverse expertise in various fields. I know in this room, we've got so many people who have got different expertise, so we really want to highlight, like understand what exactly do we understand, how do we approach the nexus between climate and health. So it's expected that this session will then to improve collaboration between environmentalists, more so climate scientists, public health experts, policymakers, and community stakeholders, especially community-based organizations, for example. And for this, we will be able to generate holistic solutions for the complex intersections between climate and health. Through this integration approach, the session then aims to ignite like a dialogue and discussion that will build inclusive partnerships and promote practical strategies for achieving meaningful impacts across the African continent. Just as an highlight, as we may be aware that Africa faces a unique set of climate and health challenges due to changes in climate, including among the following: increased, for example, infectious diseases due to changes in, of course, temperature and rainfall. That has led to spread of infectious diseases. Name it, maybe like malaria, dengue fever, and cholera, among others. We also have like extreme climate events, heat waves, floods, and droughts that has also led to injuries and heat stroke and drowning and malnutrition as well. So further to that, we also have like some other impacts, for example, mental health. As a result of extreme climate events, we find people like having some mental problem because sometimes they lose their homes and livelihoods. So some people might have experienced such kind of mental health. We also have several of them. Of course, I won't like explore much of them, but the most critical ones are, for example, like cardiovascular diseases, change in air quality and temperature could lead to cardiovascular diseases. Therefore, we are in this platform today because we do recognize that addressing these complex interconnected issues requires more than just one field of knowledge. Like, for example, climate scientists can't just like solve the whole problem. We need like bring our minds together in terms of the different diversity in terms of expertise. Therefore, this session will give us a chance therefore to discuss and brainstorm and how we can break down disciplinary silos, engage meaningfully and local communities, leverage cutting edge in science alongside traditional knowledge. So specifically, I don't want to talk much. In this discussion, we're going to discuss from a discussion of the expert panelists in this session that will bring into perspective understanding of like 5 key areas. So one of them would be like, for example, understanding innovative strategies that can strengthen partnership between the climate scientists and environmentalists. And then secondly would be some like pathways. What are some of the pathways for translating research findings into actionable policies? We know we have so much research in terms of climate research, health research, but then how does it inform policy? So we're going to hear this information from our panelists, and then some of the collaborative platforms that could enhance data sharing. We know data is key in terms of making decisions. But then, do we have those agreements or MOUs that encourage African countries and institutions to share data? So that's what we're going to discuss today. And then finally, the aspect of local knowledge and indigenous knowledge in terms of informing research. How does it inform research? So today, one of our panelists who is specialized on this will guide us through on how we can integrate this into interdisciplinary research. Therefore, I welcome and encourage everyone to approach our discussion in an open mind and collaborate with spirit as we think about how we can, how each of our fields and experiences could contribute to this shared vision. So I don't want to add much. Thank you so much for being here, and I look forward to an enriching and impactful discussion going forward. I therefore will guide this discussion as a moderator, sitting in for Dr. Pamela, who is not in today, and I will give turns for each panelist to contribute in understanding the above highlighted 5 key issues. So first and foremost, it's my pleasure to now invite James Kadura to take us through, we want to understand how we can effectively leverage existing networks at the climate health intersections to enhance collaboration between climate and health organizations and to bridge the gap between research and actionable outcomes. So thank you so much, and over to you, James Kadura. Over to you, James Kadura, if you can hear me, if you can hear us.
Yes, I can hear you.
Thank you so much.
Yes. Now, thank you very much, Dr. Kiptum. And I thank everybody and good afternoon all. As I said earlier, I'm James Kishoke Kadura, the Deputy Principal in charge of IMTR Research Division. Thank you for the opportunity to address this issue of leveraging or taking maximum advantage of existing networks at the climate health intersection to enhance collaboration between climate and health organizations and bridge the gap between the research and actionable outcomes. There are a number of measures that could be taken, including and not limited to. I'll give about 8 points. To start with, I start with number 1. There is need to form collaboration between the climate and health sectors. Very important. For example, encouraging climate actions that have health impacts, e.g., air quality monitoring and management that lead to respiratory health. Because as we all know, KMD has these facilities of monitoring air quality methods, or rather air quality, pollution or anything, and this can lead to respiratory health solutions if we collaborate between KMD, or rather KMD, and the health sectors. Number 2, we can institutionalize partnership to form joint task forces, e.g., co-hosted events, including the African Research and Impact Networks, ARIN, this conference. We can institutionalize it. Number 3, we can do joint funding opportunities, e.g., joint projects like Kenya's Ministry of Health, that is KEMRI, and KMD, IMTR, USAID-funded projects, partnership like malaria monitoring and malaria early warning bulletin for Western Kenya Highlands. Number 4, co-designing and co-production of climate-related advisories and bulletin. For example, malaria bulletins for Kenya Highlands prepared by Kenya Meteorological Department. This is at national level. If you go to every county in Kenya, we have county directors of every county, 47 of them. And these people co-produce, co-design and co-produce their advisories, seasonal advisories, with the Ministry of Agriculture. All of us do that, like that, every county. So in this case, if you can co-design nationally, we co-design and co-produce climate-related advisories with the Ministry or Sector of Health, we can come out with a very good product. Number 5, reinforcing climate health connections for decision makers and citizens in Africa. There is need to recognize the serious and sustained health threat posed by climate change and also highlight individual human stories with a strong emotional appeal, as well as connecting the health effects of climate change to frameworks that stakeholders are already familiar with, including UN Sustainable Development Goals and corporate environment, social, and governance commitments. We can make health system resilience a political imperative that is seeking for political goodwill. We can redesign health systems and healthcare delivery to cope with climate change challenges. For example, there is need to collaborate at the highest levels and support from policymakers build health, including climate finance, infrastructure, and transportation. Very important. Number 6, boosting fiscal preparedness and increased climate health financing. There are insufficient resources, as we all know, to tackle the climate health challenges. Much more financing for adaptation and mitigation needs to be unlocked. To that end, it is crucial to engage the private sector to co-design funding mechanisms. For example, banks could issue social bonds as they did during the COVID-19 pandemic, or explore revenue streams from air quality and electrification initiatives. Insurers could also play an important role in helping secure healthcare and climate investments that may be pivotal, but where risk is a key factor in decision making. Given that the health sector is currently responsible for around or about 5% of greenhouse gas emissions worldwide, there is need to develop solutions that can improve health outcomes while lowering the environmental footprint of healthcare. Number 7, there's need to close research gap between climate and health. This we can do it by the fact that we can't manage what we don't measure. Yet the nexus between climate and health remains largely uncharted territory. Connecting the dots between climate and health project outcomes and developing more robust standards and indicators are all imperatives if we want to make the investment case and adequately finance systems to prevent human suffering and save lives. Finally, but not the least, medical professionals also must be empowered with relevant information. Incorporating sustainability into medical curricula, e.g., there is need for the KMD's Institute for Meteorological Training and Research, IMTR, to develop a curricula on climate and health-related disciplines. As you have heard, we have experts of curricula development in this forum. This would encourage future practitioners to consider environmental and climate impacts in their clinical practice. For now, I will stop there, and I thank you for listening. Over to you, Dr. Augustine.
Yeah, thank you so much, James, for your insightful comments. The 8 points that you've mentioned, but the ones that caught my attention was around 3. One of them was something to do with co-production and co-design, in terms of like, do we need to incorporate health practitioners in terms of design, for example, an early warning information? That is something I think it's very key to this, into informing, like enhancing that cooperation between health practitioners and climate scientists. And then secondly, something you mentioned, something on co-design of curriculum activities. So this is something like as Institute of Meteorological Training and Research, we're looking forward to like, for example, designing our curriculum to tailor to fit into like health-related courses, climate health-related courses. And then the final one is, you mentioned something like, currently Kenya Meteorological Department does provide malaria early warning. My line of thought was like, for example, apart from malaria early warning system, would that be something kind of scale to cover the diseases? So that's something like we can brainstorm in this session. and probably it could be one of the key take homes for this session. So otherwise, thank you so much for this. And the next part of we want to hear from Dr. Margaret Kimani, like the panel question, to tell us some of the innovative strategies that could strengthen partnership between maybe academia, for example, University of Nairobi, IMTR, government agencies, non-governmental organizations, and communities that could effectively, for example, address climate and health-related challenges. So I hand over to Dr. Margaret Kimani to take us through this.
Thank you so much, Dr. Kiptum, and thank you for ARIN for allowing us to have this platform. As you realize that as we are regional center in Africa, the Southern and Eastern and Africa, we are the lead from WMO initiative. So there is a lot that we can do to innovate this partnership and strengthen it to be able to cope with these climate and health issues. One of the ways that we can do is to, as many have mentioned, is to have a co-creation of research. In the past, or even currently, most people do research in their own discipline, and sometimes they leave out some aspects that could bring on board that can really help to ensure that the research are able to have an impact to the local community. So one of the things we can do is to have a co-creation of research where we bring together the researchers, we bring the policymakers, the local communities, practitioners, so that the research can be rich and incorporating all aspects, so that we can have indicators that are well represented and that the research can also be implemented by policymakers. The other way, we can have public-private partnership, and this one can help us to mobilize the resources. And this one, so you realize sometimes scientists have the knowledge, have the skills, and sometimes they don't have what it takes to do the research. So incorporating public-private partnership can go a long way to enhance the partnership. The other way is to have capacity building through joint training programs. As a training institution and research, we have this capacity. We hold research for the African, and we can encourage many stakeholders of the Africa region to be able to to come on board, that we can do research, we can do capacity building that incorporate different stakeholders, especially in this area of climate and health. The other way is we can have participatory research. This research is like going to do the assessment on climate impact on health. The health people can help us even to come up with the relevant indicators so that which are relevant for that sector. So if we have a participatory research, we do the assessment together, we share the data for this assessment, we have our indicators as climate scientists, health sector have their own indicators, and so if we can be able to share the data and come up with the corporate research, then this is a way of having an innovation way. Then we can have incorporation of indigenous and traditional knowledge about the climate and climate resilience and healthy practices. You realize sometimes as scientists and researchers, we come up with very good research, but the community cannot really be able to associate with the science, the terms. But there is a way we can incorporate what they understand, and then we can see what in science, what is that indicator that we can bring on board to be able to incorporate their indigenous knowledge. The other way is to have the government and NGOs, academic institutions come together to have multi-sectoral action plans. Most of the time, we do action plans that are just for the discipline that we are in. But if we are able to come together as a different stakeholders, we can be able to align for example, the climate and health goals, so that even as we make the policies, that they are corporate for example, for the health and climate. We can also have education and awareness with this corporate body of institutions, where we also have education and awareness. We do it together. It brings more strength to the community. So I can say that those are some of them. I can elaborate more, but the idea is coming together, doing it together, and that way we can be able to have an innovative way. And even being able to embrace the AI technology. Realize that there are some sectors who are good at that, but so when we bring them on board, they are able now to bring their technology so that we are able to advance in science and technology. Thank you so much.
Great for well elaborated points. So based on what you've just highlighted, is basically you emphasize the aspect of co-creation of research from different organizations, both from government, NGOs, and operational research. That's key. That's something that I think we need to note from this conference. And then secondly, in terms of the aspect of public-private partnership, that's very key in terms of mobilization of resources. But then you went ahead and also discussed something on incorporating local knowledge, which I think Mr. Gadura also highlighted in his keynote question. So, but then the element of indigenous knowledge, we will further explore on that from our fourth speaker. But before that, let me go to the third panelist, Mr. Joseph Kang'ethe, to take us through on how, for example, how can capacity building activities, I know Margaret has mentioned that, but then how does capacity building initiative be designed to develop transdisciplinary research skills among African researchers and practitioners in terms of fostering collaboration across different sectors? So I hand over to Joseph Kang'ethe to take us through that discussion. Over to you, Joseph.
Thank you, Bwana Kiptum, and thank you all who are listening and participants today. As you all know, working with a brand object is somehow very inefficient, and therefore there is need to sharpen our capacity, our ability in doing the work that we are doing. And this goes far by training the participant or the collaborators and even the staff themselves, especially the meteorologists and the climate scientists, in doing their work. And when we look at this capacity building, you realize that many are times that people do make a mistake, or that people don't consider some important factors in training. And it all starts with the need. So every training should be need-based. Every training should be need-based. And therefore, one thing that we need to do is first to identify the need. And this one big reason why at Institute for Meteorological Training and Research, our courses are usually, we first find out what the person or the participants need to learn, so that it will be need-based. Number two, you also realize Sorry, getting off. Yeah, so they should be need-based. And then even when you are looking at the need, then again it should address the challenges, especially for African countries. Being a regional training center, we have realized that people come with different levels of education or understanding, and therefore even in our training at Institute for Meteorological Training and Research, we ensure that we start from where the person is or the participant is to make him or her understand what entails the training so that the person can be of good use when it goes back to the community. Remember, everything that we are doing is not just for knowledge attainment, but rather is also to help back the community, and especially in this era where issues to do with climate change are affecting greatly on the communities. Again, of course, we know that we come from different backgrounds, different geographical regions. So again, it also depends on where somebody is coming from. Somebody must identify that so that when you are giving the training, you are training or whatever you are training, you must bring back the person to where he comes from so that he may understand his area and then he will be able even to help others. Now, there's also what we call the learning frameworks. Many times that we may not look deeply into this, but it's good to understand that when you are training, you don't just train for a specific sector, because at the end of the day, the trainee or the participant of the training will go work and to serve in different areas, and will be meeting or will be working with different people from different disciplines. Therefore, that is why in our training, you realize that at the end or at the later part of it, it is mostly a practical approach. And again, it is application-based so that look at all areas of work. So we tend to take the training, we relate methodology with engineering, relate methodology with humanities, relate methodology with the other social sciences, so that this will help now in all areas. And above this, again, our training, other than just training at the Institute of Meteorological and Training and Research, we have county-based heads. And these county-based heads who are regionally distributed, every county director of meteorological services will ensure that the people in his county are enlightened on the weather patterns and the possible problems that will come with adverse weather. And as such, then he liaises with the heads of departments in that county so that they will be prepared according to the expected condition of weather. And this, you see, this will go down the local area. Every local person will know that we are expecting, for instance, you are expecting heavy rains, and this is how we need to prepare for it. There will be possibility of floods, and therefore you have to prepare this way. Other areas, they have a shortage of water, and therefore they have to think of water harvesting when they are expecting rains. Then the other thing that I want us to look at or to think about is the issue of networking and mentorship. And you realize that, especially in research, research keeps on being done, or somebody can research further on something that was researched by another person. And the idea of bringing the researchers together is very important. So even when you are training, then you also have to train on how the best way building skills for navigating the complexity and of transdisciplinary research. And this will help, especially for the young scientists or the young people who are doing research, to see what was done, maybe the methodologies that were used, and the current way of doing it. And this will enhance their capacity in doing the research, and hence will help in alleviating the problem that may come from climate change. Yes, we also need to look at the infrastructure and resource support.
Sorry, Josephat, to interfere. Sorry to interfere. For the interest of time, summarize. Thank you.
Yeah. So at IMTR, our courses are based on human needs, on participants' needs, and they are also based on how one is able to relate with one another at the place of work. That's why we are also teaching things like, or units like communication skills, whereby one can communicate, and then there's also with others. Then there's also the idea of conflict resolution, whereby one is able to even understand that, he may not be the only person to give ideas, he may listen to others, and then they can work well. Otherwise, when you look when you talk of IMTR, we are doing well, and we are all geared towards training, capacity building for the staff, and even for the local people from whichever country, at their own level, we are taking them through and make them understand the need to understand the changes in weather and the climate and what it can lead to, and how we can collaborate with others to prepare for the same. Thank you.
Thank you so much, Josephat, for that. I think you've got very rich points to add on. But for the interest of time, I will stop at that. But then I'll come back to you later. But the key thing that I picked from your conversation was something to do with like the courses offered by research institutions should be on demand based, not just courses. You need to identify the market, what's lacking in the market, and then you can develop your curriculum based on that. So I'll go straight to, for the interest of time, I'll just go to the fourth panelist for this session, who will take us on how indigenous knowledge and local perspective could be integrated into disciplinary research to enrich understanding of climate change and health in Africa. I hand over to Lucas Okach for this session. So over to you, Okach. Lucas.
Well, thank you very much. Thank you very much, everybody. It is lunchtime here in Kenya, and it's important also we take part on this important discussion. So I'll take you to whether we require indigenous knowledge in such kind of research, and I think it's very, very, very important, because any research that's done, we should have an impact-based maybe solutions. So it is important to involve indigenous and local communities in research design. And in that attempt, we create research questions and objectives with local communities to ensure the research reflects their priority, concerns, and lived experiences. This can make findings more relevant and applicable. IMTR, under the umbrella of KMD, could come up with direct research, maybe involving elements of weather and weather phenomena that contribute to climate change. But on the other hand, we require these indigenous people on the local grounds, that is in the lower levels. These people can be very, very resourceful in gathering evidences of climate change. For example, can find levels of lakes changing. We can get history of vegetation and crops and other paleoclimatic observations that are linked to climatic change. I took part in what is called participatory planning at a certain county, and we gave a challenge to these indigenous forecasters, weather forecasters, to come up with their forecast before we released ours in the county. We realized that these people came up with the same forecast that we produced. So these indigenous people are very, very important in such kind of research that we are supposed to undertake. So at the initial stage, it is important to convene a participatory scenario meeting so that views of such knowledge is captured in the intended research data. Then when we now want to make advisory, we bring the experts from different stakeholders. And in this way, maybe for the health sectors, we require people from public health. We even require doctors to come together so that we co-produce our findings and we see whether there's a link between health and climate change. And in so doing, I think we are going to do better. That is my take. Thank you very much.
Thank you so much, Lucas, for your points. So what I've captured here is the aspect of participatory scenario planning at the county level. So like in Kenya, we downscale national forecast. We have 47 counties. So after the release of the national forecast, there is what we call participatory scenario planning. So it's actually like you plan on the weather. So you have the weather. So at that conference or that meeting, for example, we invite different sectors, especially the agriculture, but of course health as well, to give us their view in terms of designing of the advisories. So that one is very key. We've taken note of that. But then I would like to go to hand over to Margaret Kimani to take us through on some of the most effective pathways for translating research findings into actionable policies and interventions that could enhance climate and health resilience across Africa. So I know there are so many research findings that have been done, but then why has that not been made actionable? So for the interest of time, you could take like maybe the minimum time possible to summarize your points. We've got like maybe 16 minutes to wrap up this session. But then of course, we still have to hand over to the audience for some few Q&A sessions. So over to you, Dr. Margaret.
Thank you so much. Yeah, one of the effective ways or pathways is to build local capacity for research. And this way can be done by investing in local research institutions like IMTR. So we can invest by providing funds, and then we can have the training of researchers, and then we can have international cooperations to be able to build this capacity. The other way is to have to strengthen the science and policy makers in interfaces. That is by being able to make the findings of the research tailored in a way that is effective for decision or is friendly for decision makers. You know, some of the decision makers don't have a lot of time to read about a lot of science, but we can make some briefs after the research, and that we can briefly say how are the research bringing the impact on climate change and health, for example. So it's like summarizing the science to the policymakers to be able to, for them to be able to implement the outcome in their decisions. We can also have the dialogue of scientists, policymakers. Sometimes we meet the scientists alone. We need these policymakers to come on board and other stakeholders, so that in that way we can make the result of the research can be well implemented and the policy related can be developed. The other way is to align the research with the national goals. And this one is very effective, can be very effective, especially when the researchers need funds from the government or from the, for example, the government or the policy makers. So if the research are within the national goals, it's very easy because they will be implementing the goals as they solve the research recommendations. And the other way is to strengthen the partnership and engagement. This is this is to make to develop policy briefs that are relevant for decision makers. So I think those are some of the things I would say. Thank you so much.
Yeah, thank you so much, Dr. Margaret, for the 3 key points. So one of them is, of course, the policy briefs. So like you need to summarize that information, that research finding for a policy measure to internalize. And then secondly, the aspect of like aligning research with national and international goals. That's a take home for that. So next would be, I would like to invite Kangeta to highlight for us in what ways can collaborative research platforms and networks, how would that be optimized to facilitate data integration across diverse disciplines and geographical regions? I know data sharing, like I mentioned before, within African institutions is a challenge, but then we want to hear from Joseph Kangeta on how this one could be enhanced and be optimized to enhance research. Thank you. Over to you, Joseph. Just what if you can hear us.
Thank you, Bwana Kiptum. And I want to go straight to what you have said. I may not cover very much because of time, but with a lot of interest, I would like to note this, that one thing and one challenge we usually have with data sharing is the policy. We realize that some countries, they have data policy that is not conducive for use by other people, and this may hinder our data use. And in this respect, then maybe we can come up with a memorandum of understanding whereby researchers can be made or can have data available for use for their research. Maybe something else that I also may talk about is we can also have our data stored in a common place which is accessible to researchers, and this will also help in the use of the data. But above all, the issue of data quality. Data quality is very important, and therefore, even when we are training, we should ensure that, and these are a common thing that are major thing that we are doing at IMTR, that the training of the quality of data is very important, and then the data storage for that purpose. For all, what I want to say is that we should make sure, and as we are doing at IMTR, that we are training people on production of good data quality, which can be used and which will be readily available. But then the challenge of policies again comes in, and this is an area that you can work on to ensure that there is good data accessibility to the researchers, to ensure that whatever you are doing will be of help to the people globally, and especially serving the people that are prone to these dangers of climate change, as far as health is concerned. That's my contribution.
Yeah, thank you so much, Josephat Kangeta, for the brief highlight on that. So under this session, I picked around 6 key points. So I would start, for example, the first one that we can take home is like co-design and co-production of climate health information. So where we need to have collaboration between climate scientists and health professionals to be able to co-design and co-produce information. Secondly is the issue of capacity building. There is need for more capacity building in terms of the aspect of health and climate on how they can be able to tie together. And then the training base needs to be market driven. So we need to train people based on market. What does the market need? So that's something that we also captured in that. And then on the indigenous knowledge, the aspect of the evidence from the ground. We need to get that information from the ground for us to be able to understand what exactly happened. And that can also be achieved through public or participatory scenario planning, especially during seasonal climate forums at national, more so at county level, for example, in Kenya. And then there is also need to research needs to be align with national and international goals. So and then there is the aspect of data sharing. MOUs needs to be signed to enhance data sharing amongst the institutions, both at climate and health sectors. So I hand over back to the floor, back to ARIN, so that they can be able to take us through the next phase of conversation. Thank you. Over to you.
Thank you very much, Dr. Kiptum and your colleagues, the team from IMTR. Really, that's quite a rich conversation, and I don't think there's anything much to add from what you have said, because you have very well outlined the very, even at the end of your conversation, just tried to pick up the summary and the key highlights from those presentations from your colleague, and to really much appreciate. Because of time, I'm just going to just see what the audience is sharing on the chat. I'm seeing a lot of appreciation of the conversation. I am seeing Mary agreeing and emphasizing that climate change is a great threat in the health sector, and our survival is really much at stake. And also just going further to enhance or emphasize that we need to invest in interdisciplinary research and cooperation. I think from the way IMTR has emphasized, co-creation of knowledge very much at the center of that conversation, and establishing strategic partnerships and multidisciplinary action. I think that's very much what everybody thinks and in agreement with. Victoria has emphasized that climate change and health is a challenge, especially now because the rains have just started. It's actually raining outside at the moment as we speak. George Croder appreciates the role of indigenous knowledge and wishes that we examine the metadata so that our interpretation is contextual and replicable. And he's kind of posing this to the IMTR team, whether this is the case, however, the metadata is always kind of examined further to ensure that interpretation is not lost along the way. So I don't know whether Dr. Kiptum, that will be responded to. I'm trying to pick up very quickly what some of the questions that can be addressed. That is alongside with the data. Ezekiel is following up on whether, is it KMD? Okay, just trying to say that KMD is the custodian of climatic data. I think we talked about accessibility of data and who owns the data and how people can access. The KMD being the custodian of climatic data, how viable is the data access? Because it's still expensive. I don't know what the approach on that, and whether you're aware and how to make that easier or simpler. And in terms of the data accuracy and quality, which is very much an issue in research, what can be done to reduce this gap, to make it possible to have the data sets that are free and open source, that does not elapse after periods of time? I don't know whether we can, we have any response to that, or maybe reaction to those comments on the data. Dr. Kiptum and team.
Yeah, thank you so much for that. I've seen a question on the chat from Washington asking, for example, like what metrics could be used to assess the impact of meteorological information on health outcomes, especially in climate vulnerable communities. So the way I would address that, for example, is to develop what we call impact-based forecasting. For example, we can quantify at what temperatures, for example, would the incidence of malaria incidence be there, and then we can be able to develop thresholds. And those thresholds should be, for example, you can say minimum, low, medium, and high. So, but based on the information on the ground. So you collect information from the ground, and then when you issue, for example, a climate forecast, you tend to understand if for example, temperatures rises to this level, how much incidence of malaria could affect a certain community. So I would answer Washington based on, like, we incorporate impact-based information. We don't just issue a forecast, but then we need to include information in terms of how much impact does can the community be affected. So that is what I wanted to respond on that. What you
Yeah, well, thank you, Dr. Kiptum. I am seeing that responses are still coming in, and most of the questions are still aligning on the data access. And I don't know whether we have a reaction on the accessibility, on the metadata question. Did you get that, Dr. Kiptum?
Maybe I can hand over to James Kadura or Dr. Margaret to address that one on data policy. Or Okach, or anyone from IMTR KMD.
Yes, Dr. Kiptum, thank you very much for that chance. Somebody, Michael, also asked about the data, whether KMD has data policy. And yes, we have data policy. And that includes even the metadata and all that. And we have a whole section on that data issues, because our director, KMD, Dr. Ikungu, has set aside priorities. You know, if research is being done by people who cannot afford data, we don't charge them anything, or we make the environment for receiving the data very friendly, without any charges and without any complication. But we fear, in our data policy, we fear duplication of data, because there is difference between data and met products. Met products might be available freely to the public, but data itself, we would avoid to give you all our database, because you might do something unprofessional with it. And that data policy takes care of all that. But we are not harsh to research. That one should be very clear. I have given in our messaging part the address, that is director@meteo.go.ke. That's where you get the right information from our director on data issues. Thank you.
Thank you so much, Mr. Gadura, for that response. Just to echo on what you've just said, is the aspect of data purely for research. So for KMD, the policy does not charge data for research. So you just need to get the letter from the research institution addressed to Director Met Department, and then you will be able to access your data. So that's what we want to do. Back to you.
Thank you. Thank you, Dr. Kathura, Dr. Kiptum, for the responses. I think most of what we think, and I think the general feel, is about the data access, and we all agree on the same things, how we need to take this on in terms of just linking research and practice in terms of the health sector. And I really want to thank you for that very well thought out presentation, the IMTR team. Really much appreciation from us, and for agreeing to share your wealth of knowledge with us. And just because of time, I think I want to draw us to a close, but invite you to the main session beginning at 2 p.m. because that is where we're going to interrogate further how we can promote, how we can partner or collaborate better, how to enhance our collaboration, even from the question that we've just discussed now. How can we share data more? How can we ensure that we, because I think connecting what we are doing as institutions and researchers, as policymakers, has always been a problem. But let's have that conversation in detail at 2 p.m. So we invite you to join us from there. But just again, to appreciate the IMTR team and you participants. We're going not to switch on this channel. We're not going to end the link or the meeting, rather, but we're going to leave it open for just the 30 minutes break that we're going to have. So you're free to just mute yourself, you just switch off your camera. You're free not to leave the link, or maybe you can just leave and join it back at exactly 2 p.m. where we are going now to just start the plenary session. And you can also invite your colleagues to further join us so that we can interrogate that further. So without taking too much time, let me end it there and just appreciate you so much for that session and being here. So see you at 2 p.m. Bye-bye.
Thank you very much.
Thank you.
Thank you.
Hello, and welcome back to the main session. I want to welcome everyone, those that have been here from the very first session today or even yesterday, and now just reconvening to consolidate our minds into talking about opportunities for enhancing transdisciplinary climate and health, the conversation that started yesterday. I want to welcome you and request you to introduce yourself, just Just type your name, your affiliation, and if possible, your contact details if you'd like to connect to other participants, and even just to just to know where you're joining us from. Whether it's in the country, outside the country, or elsewhere. I see Karadi Right from South Africa is our keynote speaker for today. Welcome. Continue introducing yourself as we wait for others to join us. I'm trying to see who else is in the room. Just type, introduce yourself. And just to mention that we have French translation for those that might require that translation. Welcome, Jonathan from KMT Makueni County. We are pleased and honored to have you here. And I think I noted your presence yesterday. Karibu sana. Caroline Muthoni from Aga Khan University and the Chance Network. Nice. Really glad to have you here. Continue typing and introducing yourself on the chat section. I mention again that we have a French translation. If you're joining us from a Francophone speaking nation, feel free to switch on to the French channel so that you may follow the proceedings accurately. Welcome, Edna from StatSpeak. Happy to have you here. Just hoping to have more of us join us. Just also to make it known that this session is recorded, just for your information. Yeah, I'm seeing more of you. Aline, karibu sana from Arup. Nice to have you here. Just before I give a brief recap of what we've been discussing yesterday, my name is Victoria Chengo. I am in charge of monitoring and evaluation here at the Africa Research and Impact Network. And I'm really glad to take you through this session. I'll be your moderator for today and hoping to engage you in one way or another. We're going to ensure that we have an interactive session as possible, so stay tuned. So today we want to interrogate the aspect of transdisciplinarity. As you can see from the main theme of the conference, we have been trying to bridge that gap between knowledge and practice in terms of where the climate and health intersect, that intersection to see how we can connect these two sectors and just try and interrogate the challenges behind the climate and health interconnectivity. So in yesterday's session, we saw case studies. We saw a case study from the SDI team, that is the Slum Dwellers International and Muungano wa Vinavijiji here in Kenya. They showcase some of the community-led ecosystem-based adaptation methods or measures that they are undertaking, such as connecting and linking with various youth groups, and trying to outline some of the challenges that in particular affecting the urban informal settlements. Flooding, I think, has been one of the major climatic risks when we want to look at the health issues. It has come up a lot in some of the conversations we've been having. We had a case study from our keynote speaker who has been working a lot in Nicaragua and giving us an outline of just trying to show how application of data, real-time data, in trying to bring out how some of the challenges issue. And I think he very well connected the issue of kidney or prevalence of kidney diseases to climate, like how climate change has made the cases of kidney diseases to renal failures and all that to be. So I think we have so many of these cases, and we can tell from our day-to-day activities and our research work we've been undertaking, how this is really affecting us and how some of these issues are coming up. Just before this session, we had the team from the Meteorological Training and Research in Kenya, the institute, that brought out some of the issues they face as an institute of research. And I think the main takeaway from all the sessions we've been having is we need to co-design and co-create our work. We need to align our interests and what we are doing with, the focus of the national focus and even the international discourses. But how do we do that? We need to come together. We need to share data. We need to connect from one point to another. We need to understand the issues that we are facing. So that is why we are here today in this session. We want to interrogate how we can exist together, how we can work together, how we can co-create and co-design. So we have outlined speakers. We have questions that have been prepared to help us to delve in this question and how to link the existing networks. Yesterday, also, IRIN presented a case of the capture platform that has been launched to consolidate information and data and all the platforms and link to other networks working in the climate and health sector. This morning we had from the Locally Led Adaptation Metrics for Africa platform as well, that is also trying to use a case study from Kenya, the Lake Region Kenya data that has been consolidated there, to use that as a case study to help other regions as well to consolidate data and collect that in terms of what is happening at the local level in the communities. So I would like us to switch on now to maybe just to project how our program looks like. We will begin with a keynote address, just straight from this. Then we will have our main discussion. I'm just trying to see whether the discussants are already in the room. And then from there, we will have case study presentations, mostly from PhD students who are working on cases related to the subject we are talking about. And then we will have a panel discussion that will tackle some of the key questions that we want to have today. Just to repeat again, continue introducing yourself on the chat section as we move along so that we may know you, may connect with you, and then we move forward. So without taking too much time, I would like to, I see Karadi is here. I want to introduce her. So Professor Karadi is a chief specialist at the South African Medical Research Council, and she's leading the climate and health research program there. And she is also a professor at the University of Pretoria and the University of Johannesburg as well. She is very well informed and she has very vast knowledge in this area, and she's worked a lot trying to understand climate change and air pollution impacts on human health and well-being to inform adaptation. So the question we have for Professor Wright is, how can we effectively leverage existing networks, such as, ARIN, the chance network, capture, and all the platforms that are existing at the moment that are looking at climate and health intersection, to help these networks to enhance collaboration between the climate and health organizations, and to bridge that gap that we are seeing a lot being discussed between the researcher, the scientist, and the actionable outcomes, which mostly falls on the policy side. How can we enhance this network? Because it's been a key question, and I don't think we have had a straight answer to this, but we want to kind of see how can we possibly try to bridge that gap. So Professor Wright, if you're ready, please, let's carry on.
Thank you very much, and hello to everybody. It's a real pleasure to be with you here. This is such a great meeting. Shall I share my slides?
I think I have a copy of your slides. Yes, let me just pull them out.
Okay. I don't mind. I also have them with me.
Yeah, actually, it had skipped my mind that I have a copy of them, but yeah, coming right up.
Okay, thank you. There we go. That's great. Thank you very much. So I have a challenging task to talk through today, and it's not an easy topic, and I know that many networks around the world are grappling with some of the tensions between research and policy, as well as climate and health. And I hope that I'll be able to shed some light on this based on my experience today. To effectively leverage existing networks at the climate health intersection, we need to enhance the collaboration between climate and health organizations, bridge the gap between research and actionable outcomes, and ensure that these networks can facilitate shared knowledge, resources, and practical solutions. I'm going to go through 8 different topics or aspects that I think are critical to help us build these networks. So first of all, creating joint platforms are critical. Facilitating platforms where climate scientists, public health experts, policymakers, and local communities can all collaborate. And I've mentioned a couple here, for example, Chance, and I'm very pleased to see that we have someone from Chance with us. So Clim Health Africa, a network for collaboration and engagement, really to strengthen research across different networks and eliminate silos, which we know is a major challenge. The Climate Action Network is an international organization of almost 2,000 civil society organizations in more than 130 countries, and they really drive collective and sustainable actions to fight climate change and then trying to achieve social justice. From a multi-sectoral collaboration perspective, I'm involved in a project called Planet for Health. You can Google that, you'll find that we have a website. And in that project, as overwhelming as it is, there are 17 partners from 12 different countries who have come together to make sure that we can try and translate our evidence and data into meaningful things like early warning platforms, early warning systems on platforms or applications. Next slide, please. The next thing that's really important is building research and practice. In this instance, the first point is to translate science into actionable policy. And that's really complicated. So the diagram at the top right tries to explain to us that we want to get from science to policy, but there's no straight line between the two. We need to go through a circular process, filling gaps in data and knowledge, integrating these through interdisciplinary decision support tools and integrating them into what is currently going on the ground. And you can imagine how difficult that is because there's so much going on, so many wheels are turning in the implementation space. It's very difficult to push something new unless it is really, really well explained, tangible, and the immediate benefits can be seen. So we have to raise awareness and try and find the best policy gaps or questions that we can fill with the data that we have. An example that I'd like to share with you in this regard is taking the work that I've been involved in, looking at heat risks for health in the African context, especially in South Africa and vulnerable settings, and using that evidence, the published scientific articles, in our National Heat Health Action Guidelines for South Africa. In other words, I was able to show data that explain that temperatures, for example, in schools, in clinic waiting rooms are exceptionally high and placing people at risk. And so therefore, in the policy document, there's a section on how to address heat in schools and clinic settings. The second point there is around encouraging collaboration. There's really so many benefits of collaboration. You get access to new databases, you can get new skills and expertise. So for example, at the moment, it's really important if you're wanting to do an environmental epidemiology study to understand the associations between climate change and health, something like attribution and detection studies. You have to know how to run models, for example, the distributed lag nonlinear model. And so you will have to collaborate with someone who can help you learn how to run the model with your data. It certainly attracts more funding when there's these large partnerships, and it can expand the reach and impact. It also supports your students and your postgrad students. It definitely ensures that you can maximize your output and does foster a sense of community. And then finally, the plot on the bottom left hand of the slide is a off the press infographic from some work that I'm doing as a NIH scholar, climate and health scholar from 2024. I've been working on trying to understand how we can best assess interventions that are helping to try and solve climate change and health problems, particularly adaptation interventions. How can we ensure that these interventions are successful? When should we actually start to think about what we need to do to ensure they're successful? And in this case, we've come up with a brand new tool, set of indicators and metrics that actually require us to start at the co-design inception phase of an adaptation intervention project. Next slide, please. The third step that I'd like to talk about is about data sharing and integration. It's a little bit of a small plot, but there are nowadays so many open data platforms. There's Google Maps engines, CCAN, and so many others. And I think the most important thing is to realize that there's both pros and risks associated with using open data platforms. First of all, it's great to be able to access open data because you can apply it in your own setting, but be very cautious when you place your own data on these platforms. And please realize that in some instances, the data is gone and no longer yours to use solely. So make sure that you've used the data to the full extent that you want to do so before you place it on a platform like this. Data standardization is critical. When you are trying to do an inter-country comparison, because each country has its own way of keeping data, for example, mortality data or morbidity data, it's really difficult to be able to merge data sets. And you have to do manual unless it's really, the data appears in a standardized way. You can do it with some coding. Otherwise, you need to do a manual process to make sure that you can make both data sets look alike to do any kind of work with them. So we really are trying to encourage researchers to, and obviously the people creating the data set, so that's oftentimes government, to try and do this in a more globally standardized way. And then if you click the button one more time, please. There's been some work, especially globally, but also in Africa, using sensors, low-cost sensors, to measure air quality around the world and in Africa too. So the sensor little box that you see at the bottom of the picture is illustrating a low-cost sensor that we've been using here in South Africa. And some of the findings that we've got from this sensors, particularly for particulate matter 2.5, so PM 2.5, and we measured in both urban and rural dwellings in a summer and a winter campaign. And the two lines, with the one with the thicker dash, is the World Health Organization's air quality guideline value. You can see that we are well above, the data is showing we are well above air pollution concentrations of the WHO guideline. And the other line is the South African national standard. And in most cases, except during the summertime, at the rural site, again, we were seeing data well in excess of our standard, indicating that there's great risk for these individuals. But this data can be live streamed to your computer so you can actually see them coming in before you do your final analyses. And this is definitely something we're wanting to be doing more of in the future around the world, particularly in the climate context. Next slide, please. So building capacity for implementation. You know, we have to make sure that, as I mentioned earlier, co-creation of projects is critical. We don't have the luxury anymore as researchers to be sitting in our offices, perhaps with a friend or a colleague, coming up with a proposal, implementing the proposal, implementing the project, writing an academic article, publishing it in a journal, and saying, there we go, job done. It's not that anymore. Research has to be meaningful. Countries, even African countries, are beginning to spend more money on research investment. I wish I could say that all countries were, but I know it's not the case. And in Africa, most countries don't even spend 1% of their GDP on investing in research. But this is going to change. And what this means is that we have to be together. Our decision makers, our stakeholders, the policymakers, and the researchers have to be together from the beginning to make sure that we answer problems that are actually facing people in communities today and not something that is not necessarily needed. That's really unethical research. But in order to do that, we have to ensure that the people that we are working with completely understand and on the same page as us regarding sometimes quite complex issues. So we need to offer capacity strengthening programs. And the example here is work that I did in the Northwest Province in the town of Rustenburg in South Africa. We were bringing together multiple stakeholders across both local and municipal governments, as well as NGOs, not only from health or from environment, but also from sanitation, education, basic services, waste, and other sectors, because people don't realize that climate change actually affects every sector, not just health and environment. And then the example on the right-hand side is a really fascinating case study from Senegal. So if you could just go back, please. Thank you. So in this situation, the community was facing severe drought. This part of the world is experiencing drought, as we know, and they did not have enough water to irrigate their rain-fed crops. And if there was no rain, then the crops were not being watered. So together with researchers, they set out to conduct a project, and it included sensing whether there was water available underground. In this instance, there was, but they had no power to bring the water up via a pump to the surface, so they used solar panels to do so. And this then brought a steady stream of water from underground to the surface that was used to irrigate the crops, but not only that, also to support water for consumption and cooking and hygiene process and so on. This is an example of a local adaptation strategy that we should really try and support. It's tailored to local circumstances, and that's really what we need. Next slide, please. So in terms of facilitating policy advocacy and public awareness, one of the first things we need to think about is engaging in joint climate health advocacy campaigns to highlight the co-benefits of climate action for public health. So common messaging can then raise awareness among decision makers and the general public, and emphasizing the integrated and urgent need for solutions. So the story I'd like to tell you about this one really is about including vulnerable communities in doing this. We have to include Indigenous communities, low-income communities in the conversation so that we can get towards a sustainable solution. So this is the story of the deadly air case in South Africa. It's a really pinnacle case because, as many may know, South Africa has some of the greatest number of coal-fired power stations on the African continent, contributing sulfur dioxide in large quantities and contributing towards global warming. Not only that, the air pollution is causing several health impacts in the communities living nearby. And so the communities, led through an NGO as well as advocacy groups and a Centre for Environmental Rights, took the Constitutional Court of South Africa to court for the breach of the right to clean air as stated in our national constitution. Now, this is exactly something that has triggered raising of awareness in the community, because very, very few people realized that the air pollution they were breathing came from the power stations, and also, unfortunately, from household air pollution sources, for example, burning in their homes. So it's really raised awareness around the air pollution impacts on health, but it's also pressed our government to act and do more to protect the health of human beings in this part of the world. Next slide, please. So advocating for integrated funding is another challenge. Globally around the world, there is generally insufficient investment in adaptation and mitigation. In other words, the actual implementation of projects to try and solve massive climate change problems, prevent adverse health effects, and try and be prepared, particularly in the instance of extreme weather events. Some organizations, like the Wellcome Trust, have really prioritized climate change as a key area that they want to work across in the next several years. And so they have 3 streams in climate change: heat, infectious disease, and mental health. And they are spending a lot of money supporting research, including in Africa, to try and really, as they say, unlock urgent climate action, but underpinned by the evidence needed to do so. But the graph on the right shows us that we're just falling short for climate finance, particularly for developing or low and middle income countries. And where we see the challenges is actually in mobilizing private funding or private sector funding. We're not doing very well in that regard. Multilateral public funding and bilateral public funding is kind of increasing slightly over the years, but still we just don't have enough. If you push, please, the next button, please. These plots illustrate to us there is change in how our funding for climate change and health is changing. So the top left is the percent of climate change and health projects by fiscal year. You can see a steady increase from the 1980s through to 2021. The same is true for the cost of the projects that have been funded over the years, as well as for the number of projects being implemented, almost up to 600 of these types of climate change and health projects in 2021. And then the percentage of these projects compared to the project costs has also been a substantial change. So there's definitely hope, and we have to find ways to tap into these funding sources. Next slide, please. Engaging the private sector is tricky, particularly as researchers. We need to find creative ways of doing so that doesn't present reputational risk. So, for example, I've done a project with our national energy supplier, which is Eskom. They are the parastatal and essentially a monopoly, as there's no other power source. And it was a huge task to get my organization to accept that I would be doing the work independently, not influenced in any way by the power supplier, because of course, there could be nuances in what they would like to disclose and not disclose. So collaboration can be difficult, but it's not impossible. We can think about collaborating in things like renewable energy, in transport, and in technology solutions. They can also play a critical role in reducing carbon footprints, which I'll talk to with the little photo in a moment, and also helping to invest in public health through cleaner technologies, climate resilient infrastructure, and community health programs. So this is actually an interactive plot. I encourage you to go and have a look at it. It's on the Healthcare Climate Council website, and it's of a hospital. And essentially every point that you click on that table on the right-hand side will show you how that you can reduce their energy levels to try and reach the pinnacle of being a green hospital. And this goes through from energy through to food and waste and transportation. If you click the next point, please. This is a figure that comes from the National Health Service in the United Kingdom's work that they're doing to try and get to net zero. In other words, they want the National Health Service to have no carbon emissions, which is a huge, ambitious goal. And how they plan on doing that is they can't just do one or two things. All these different colors are outlining different things they believe they should do if they're wanting to drive themselves down to zero carbon emissions by 2050. And some of the things are things we've never thought about. Travel and transport. If they want to get to carbon zero, and they need to encourage not only the staff who work in the hospital, but the patients who visit the hospital to use green, renewable energy transport to get to the hospital, because that is included in the calculation of their carbon footprints. And interestingly enough, the NHS in the UK is the first country in the world, as far as I'm aware, that has got a green renewable energy ambulance, which is definitely great progress. Next slide, please. So I believe this is the last set of points that I'll make before I conclude. This is about leveraging international cooperation. And this is certainly not easy. It really comes from relationship building and meeting people and engaging with people in a meaningful way. International agreements, such as the Paris Agreement and the Sustainable Development Goals, already provide us with platforms for cooperation between countries on climate change and health. And if we engage with these global frameworks, both nationally and locally, across regions, continents, and globally, organizations can better align their efforts and share best practices. And often this is done through the very networks we were talking about earlier, like chance. Attending a chance meeting gives you the opportunity to meet a fellow colleague in another country. You may then decide we should work together, look at the SDG framework, and try and tackle one of the problems in that framework in both countries. And then, of course, knowledge exchange. So fostering global partnerships for knowledge exchange between countries that have different levels of resources and capacities. So there's much for us to learn in a low and middle income country setting if we see what is being done in a high income country setting. It's not to say that we can transfer it like a blueprint to us, but it will certainly spark ideas on how we can do things differently. Low and middle income countries can learn lessons from high income countries and vice versa. And that's something critical that we should remember. And my final slide, please. So I personally believe that by strategically leveraging networks, integrating diverse expertise, sometimes we don't even realize that's important in a room of climate and health scientists to have building design people, for example, and fostering inclusive action-orientated partnerships, the climate health community can bridge the gap between research and actionable outcomes. And this approach will not only lead to more resilient health systems, but also will contribute to achieving some of the broader climate goals, ensuring that climate and health action are mutually reinforcing. Thank you for the opportunity to speak with you today.
Wonderful. Thank you. Thank you very much, Professor Wright, for really much and very giving with case examples, just outlining some of these issues and some of these ways that we can enhance and ensure that the existing platforms work together. I think this is very critical. And if I may be really biased and just pick up my, best three that I really feel like we need to give a bit more emphasis, as you really outlined. Developing clear metrics for impact. I think when we want to bridge this gap between research and practice, we have to really ensure that we're working and we're looking at this from the same lens and using these metrics to ensure that we kind of align our work and towards the same goal. I really like the part of data sharing and integration because this is very contentious. It has been talked about, alluded to severally, because access to data has been one of the key things, but having open data platforms could be one way of ensuring that we are working together, ensuring that we have data control standards and promoting the use of technology to help us in the data sharing platform. And I think we are heading towards that direction because I think this conversation is happening here so that we can move forward. Engaging the private sector comes out very strongly, and I really like that it is part of your key points because this is where much of the on-ground work happens, much of where the private sector is really kind of doing the hands-on work and touching towards scientists and researchers are kind of trying to look at. But I really thank you very much, Professor Wright. This is very, very, very helpful. And I hope all of you participants are taking note of this and appreciate that presentation and that keynote address the way I do. Thank you so much, Professor Wright, and for your time to be here and just preparing all that presentation and delivering to us. We really very much appreciate. We have a next speaker. I don't know whether I'm leaving you out, Dr. Mushangi, but I cannot see you on the list of participants. But if you happen to be there, kindly just speak up so that I don't skip your presentation. Dr. Martin Mushangi, if you happen to be there, just give me a nudge so that I can give you the chance to speak. And if not, we can move forward to the case study presentations. We had abstract submissions and we have 6, but I can see 5 presenters who are ready to share with us their findings and or probably what they are working on related to bridging this gap between research and practice. I would like to see who is ready between Bind Nyirongo, Dr. Christine Musiemi, from the Africa Institute of Mental and Brain Health in Kenya. Brain Nyirongo is from University of Zambia. Edna Dindi is from StartSpeak Group Limited. Janlik Mwangi from Mary University of Science and Technology, and Dr. Rollins Dejo from Makerere University of School of Public Health. Dr. Christine, I am told you're ready to make your presentation. Are you here, Dr. Christine? See me?
Yes, please. I'm not sure I could probably share my presentation, if that's okay.
You want to share from your side?
Yes,
Good.
or do you prefer
please
clear instead? Okay.
Please go ahead. Yes. If you could put it on presenter mode kindly so that we can see your entire screen. Yes, we can see.
Great. Hi, everyone, and thank you to ARIN Network for the invitation to be part of this great conference. And this afternoon, I'll be sharing a case study that was funded by National Institute of Mental Health. It's a first grant, R21/R33. So I'll just be sharing on the R21 phase of the project. This project is implemented through a collaboration with the Africa Institute of Mental and Brain Health, or AFRIMEB, which is based in Kenya, Upper Hill, Columbia University, and Kenya Meteorological Department in Kenya. So it is being hosted at AFRIMEB, but it is a collaborative grant. So I'll be sharing on the development of an ecological momentary assessment smartphone app, or the EMA app. And the idea is to develop an app that collects climate-related stress and intimate partner violence assessments in Kenya. So my research background is in global mental health research, but I've also participated in some work on climate change, and it will be one of the projects that we are implementing for more settlements on climate change and mental health, specifically addressing intimate partner violence issues in informal settlements in Nairobi. So just to give you a background and why we are doing this work in informal settlements. So women in informal settlements in Kenya and in Africa are exposed to increased aspects or increased experiences of intimate partner violence, as well as the effects of climate change, extreme weather events, heat wave, flooding, rain, or aspects of cold spells. And this really increases the stress in the home and worsen intimate partner violence experiences. And especially, and when we are talking about household or intimate partner, we are looking at someone who is married, cohabiting, or a partner who may not necessarily be living with full time. And such kind of experiences worsen intimate partner violence experiences. So just collecting real-time data on the relationship between intimate partner violence, or IPV, that I'm using continuously, and climate change related stress is important in order to be able to develop surveys that capture the local context challenges and be able to address what works for the African context. The purpose of this NIMH-funded study is to develop an EMA application in order to collecting real-time data on intimate partner violence experiences, aspects of emotional distress, safety, social support, and any climate-related discomfort among women experiencing intimate partner violence in two large informal settlements in Kenya. This is Kibera and Mathare. So as a start, we engaged community members through a community advisory board and mobile health experts to develop an application, the EMA app. That is the photo that you see on the left is called a Commander app. It's on Google Store app, but the user of the app at this stage is limited until we test it. And so it has both Android and iOS versions, but whatever is currently on Google Store is the Android app, and it features a decoy app, which is in form of a water drinking feature, but that is not the main app. And so I'll be sharing the rest of the app in the next slides. So these are the main sections. So when participants or individuals or women experiencing intimate partner violence click on the app, download it into their phones, the first thing they see is a decoy app. And the decoy app is basically to hide the main app that asks about intimate partner violence questions, emotional distress, as well as climate-related aspects in terms of safety. So when you look at the enjoying the app, share with a friend, that's an emergency contact. It is in two places, at the face app as well as inside the main app. So that's usually an emergency button to just click and, in case you need any kind of support or safety, whether there is an extreme weather event or no extreme weather event. So this is just, I won't talk much about the decoy app because it is just, the space app to just introduce the main app once you click on it. So, so once you click on the settings button, it takes you to enter PIN, and this is the place where participants register, or women experiencing intimate partner violence. But there's at this point the PIN is to restrict specific users because now it is on Google Store. So we are only restricting it from this point to study participants, and only for those that will be able to participate. So once participants are able to register, input their PIN, then what comes up are 4 icons. We have the surveys that they do, when we have a baseline, we have an extreme, when there is an extreme weather event. So we've already conducted the baseline survey. And then once participants complete their surveys, they see maybe they've completed 3 times in a day, or in the morning, they're able to view their trends and how the graph looks like. And if, at this point, if they're in the survey, they need to use an emergency service, then they press that. And in case they need to access any services, they also press that icon. So once the app was developed, we tested it. Sorry about that. So once the app was developed, we tested it in 2 phases. So the first phase was among 6 application app developers or experts, M-Health experts, as well as people that have actually used an ecological momentary assessment application. So the idea was to test the design, the functionality, as well as the content. And then in phase 2, we engage people in the communities, and these are community health promoters. In our context, different countries use volunteers, use workers, but currently in Kenya, we use community health promoters. The idea is to assess, because this is an application that will be used by women experiencing intimate partner violence. What we wanted to assess for its use, cultural relevance and practicality, and then feedback through this, the testing phase was provided through 6 individual interviews and 1 for discussion. So I'm not going to have a look at, read everything. I'm just going to highlight 2 key aspects or, important feedback that we received, or, experts and community health promoters found that the application is user-friendly, it is culturally appropriate, and it can actually be used for collecting real-time data. And one of the experts mentioned that the app is very straightforward and all the features are visible from the start. So I think everything is well presented. And then one of the CHPs said that I love the app because of its simplicity. It is easy to use, it is easy to navigate and to read. And even if you receive a reminder and you're on the move, you can be able to stop and actually fill the survey, and many other feedback aspects that we received from different participants. And then in terms of improving the application, participants suggested aspects of improving navigation, trying to make the SOS or the emergency contact, rather than just it being in the main app, we had to have it in 2 places so that as long as you're in the app, you're able to, access an emergency service. And then instead of having just one multiple contact, participants suggested, an option for having 2 contacts or changing the contacts just in case you don't need that contact at that particular time, and then improve on the loading so that participants see their graph over time. So in summary, we have already developed an app which marks an important step in understanding the link between climate-related stress as well as intimate partner violence. And so currently the app, we're using the EcoMinder app or the EMA app to among 320 women in Kibera and Mathare informal settlements to test it, at the beginning and see what areas do we need to work on in order to develop an intervention in the R33 phase of the grant, and explore any relationship between, aspects of intimate partner violence, safety issues, as well as climate-related stress. For example, are the participants comfortable in their, current environment, and what can we actually do to improve that? And then the findings will be able, of course, to inform real-time interventions to reduce the impacts of both intimate partner violence and climate change in vulnerable populations. Not just in Kenya, we are hoping that, large-scale use of this particular app, not just in Kenya, not just in formal settlements, but in sub-Saharan Africa. Thank you very much.
Thank you, Dr. Musimi, for that very interesting presentation showcasing how technology can be at the forefront of, dealing with the issues we are facing, health and climate change, bridging that gap. And I'm really glad to see the results and the impact of how it has been perceived, the app, and how the usability is very friendly, and just to see what is coming as evidence or maybe testimony that this is really timely and very helpful to the community. Thank you also for keeping time. And anyone in the audience who has a question for Dr. Musimi, kindly just post it on the chat. And I would advise, because of time here, Dr. Musimi, if you see a question posted, if you are able to just kind of interact with the question on the chat, it will help us to save time. So thank you very much. And we look forward to seeing more coming from your research as well. I want to call on the next presenter. Bain, are you ready? I think I have your presentation. Are you ready to go next? Bain Nirongo?
Yes, I'm ready.
Okay, good. Let me just pull out your presentation. And if we can keep time with the presentation, taking the shortest time possible, we'll really appreciate. Thank you. Go ahead, Ben.
Okay. All right, thank you so much. Good morning, good afternoon to everyone. I'm Nyirongo Bainage from the University of Zambia, Department of Education, Psychology, Sociology, and Special Education. This afternoon, I'd like to share with you a topic, research results on insights on assessment of children with developmental disorders amidst the climate change in Zambia, a parent perspective. Next, please. Next slide. Okay, next slide.
Okay, just give me a moment. Just want to see what the problem is. Okay.
Okay, that is my presentation outline. Can go to the next. Okay. That is my presentation outline, as you can see.
The slide is big stop. 20 more. Okay. Just give me a moment.
All right, thank you so much. Still rolling. Okay. I can proceed?
Kindly proceed.
Okay. Thank you so much. I would like to emphasize that disability assessment is key in determining service provision to children with developmental disorders. And we have to understand that when we are talking about assessment in the context of disability assessment, we are simply looking at doing an evaluation of child abilities for health service provision as well as for school placement. From educational background, so I'm so much interested as well how the two link and how climate change comes in or affects the two. So climate change has demonstrated that it has the power to disrupt smooth running of assessment activities in Zambia. You can push it a little. Can move it up. Okay. All right. So benefits of assessments. Number one, we are saying that once the child is assessed to have developmental disorder, we are aware that the child will be given educational services appropriate. That is, if the child assessed can be sent or can be placed in a school where he can receive educational services that are appropriate for him or for her. Not only that, after disability assessment, the child is able to receive health services which are appropriate as well. For example, treatment. Okay. And we're also saying that disability assessment generally has got the power to improve quality of life for children with developmental disorders as well as their caregivers. How does this happen? For example, a child has got autism or a child has got cerebral palsy, you will discover that these children may be subjected to treatment from a health or clinical point of view, reducing the impact of the behavior coming out of the child as a result of the disability. Disability assessment also determines the severity of the condition. So if we are not doing disability assessment, or disability assessment is being affected, then we should expect poor quality of life among these children as well as their caregivers. Despite the huge benefits of disability assessment, climate change has shown that it can disrupt or distort the smooth running of these assessment services in Zambia. This study was so much interested in trying to understand how climate change is being managed in an effort to improve or not to disrupt disability assessment services in Zambia, particularly here in Lusaka. Statement of the problem: the Minister of Education as well as Minister of Health values education and health for these children with developmental disorders. The two work closely to ensure that children are appropriately placed in schools and also receive appropriate health services once they undergo an assessment. However, it is not clear how climate change and its effect on assessment of children with disabilities is being managed. So this study mainly focused on trying to understand how climate change and its effects are being managed to ensure that the assessment services still run smoothly in Zambia, particularly in Lusaka. Objectives. The first objective was to explore assessment services that are being offered in selected assessment centers amid this constant climate change in Zambia, to find out perceptions of parents on assessment of learners in disability and educational psychological centers in Zambia, to ascertain the challenges of diagnosis of children or children with disabilities in the face of changing climate environment. And the last objective was to establish strategies to address climate change challenges in Zambia, particularly Lusaka. The next one. Okay, can go to the next. Okay, research questions are basically the mirror of my research objectives. Can go to the next. The theory that guided this study was the ecological theory by Bronfenbrenner. The ecological model, or this theory, explains the multi-level impact on environmental systems on child development. And the child that we're talking about in this case is a child who has a developmental disorders. This theory emphasizes the importance of the 5 layers, their interconnectedness and its power to the development of the child. So the first one, we've got the microsystem, mesosystem as the second, exosystem, macrosystem being the fourth, and the last one, chronosystem. We are saying that togetherness, when systems operate together, we have got the power to overcome challenges that the climate change is bringing toward the assessment provisions or assessment services for children with developmental disorders. And the main focus or the point of focus in this system is the last one, the chronosystem. We are saying that this system focuses on the shifts that occur in society, which results to certain implications in people's lives, particularly children. So what is the shift that we're talking about? The shift here is climate change. Therefore, we are saying that systems must operate together to ensure that we achieve a common goal. And the common goal in this case is managing effects of climate change to avoid disruption in disability assessment provision. That is in Zambia assessment centers, particularly Lusaka. Go to next. This is the literature, part of the literature that has been extracted from the study, where the first one is the Rhodes and the Friends 2006, who talked about personnel in disability assessment. The main findings from this study were that identification process of children with disabilities should include neighborhood watch or community health facilities, as well as social community committees. They must work together to ensure that children are identified early and are referred for assessment. But the study did not show a linkage between the effect of climate change and the assessment process, which this study tried to address. Matafwali 2014 also did a study on design and validation of assessment tools for young children here in Zambia. And the researcher noticed that most tools that are being used in assessment centers have cultural issues in the face of climate change. Thereby, they tend to misdiagnose children who have got the mental disorders. The study also, as a gap, did not appreciate the importance of transdisciplinarity as an effort. The last one is by Sergio and Ramo 2014. Evidence of Hispanic paradox from the poverty and disability nexus in the retinal farm workers population of the United States. It was noted that disability assessment is costly, and most of the children or people from low-resource societies find it hard. And this study did not also pay much attention on the effects of assessment, climate change, relating it to disability assessment. This one, as in terms of methodology, it was a purely qualitative study in which a case study was used, and the population included parents, education standard officers, head teachers, special education teachers, medical doctors, psychologists, and special education assessors. Total sample size was 34, and the data was analyzed thematically. What assessment services are being offered in selected assessment centers in Zambia, particularly Lusaka? Participants reported that psychological assessment, ADHD assessment, intellectual disability assessment, personality assessment, and executive function assessment are being conducted. One of the assessors had this to say: at these assessment centers, we do these assessment services: ADHD, psychological assessment, intellectual, personality, and executive function. So these are main of the assessment services that are being offered amid this climate change in the Zambian context. Next, please. The implication, the impact of climate change on child assessment process. The study revealed that some parents miss out appointment dates for assessment or review dates due to, for example, flooding of the roads, or sometimes bridges which are being washed away. So they would rather not go for the appointment because roads have been disrupted because of the weather pattern or the floods. Caregivers also sometimes become sick because, for example, those who are from road-sourced communities, their homes, you find that they're flooded. As a result, they become sick of malaria and other diseases. Therefore, they won't be willing to take the child for assessment in a nearby assessment centers. Also, parents would resist to go for assessment centers to take their children because of long distances they have to walk to these assessment centers because of unprecedented heat that are being experienced due to climate change. One parent had this submission you know what? It is difficult to keep appointment date due to damaged roads and excessive heat, which is as a result of prolonged weather patterns. Sometimes I'm sick because of floods. Therefore, I am unable to take my child for disability assessment. Please. Next, please. Okay. Parents' perception. What's their picture about disability assessment amidst climate change? Mixed feelings were noted. Parents said that we know that disability assessment are key for our children, but sometimes you find that because of unpredictability in the weather patterns, it is difficult to know whether tomorrow I will go for disability assessment of my child or not. Sometimes the assessors themselves, they are unavailable because of the same weather patterns. Next, please. This is one of the parents who provided this submission. She says, we know as parents that assessments are good for our children in terms of receiving health services and school placement. But as at now, it is hard to finish the assessment process because of the unpredicted weather patterns, resulting to missing reviews, or also the doctors or other assessors not being available as stated earlier. So this is an impact that climate has. In terms of the challenges, a number of the challenges were noticed in terms of disability assessment at this point in time when climate change is at peak. One of them is the lack of adequate partnership due to climate change. Different professionals are not working together, are not entirely working together because climate change is also impacting them in one way or the other. Therefore, a parent, for example, I'll give an example. We have got a assessment center at the University of Zambia, assessment center at University Teaching Hospital, and also assessment center at Zambia Institute of Special Education. Now, these three are the main assessment centers in the country. And once a parent starts the process, you'll discover that it will be sent to move from one point to another. We'll come to the university, we'll go to the University Teaching Hospital, and also to the assessment center, which is somehow also very costly on the part of the parents. It was also noted.
May I kindly interrupt you? I would like us to wrap up. This is a very interesting presentation, but because of time, because we're already over 20 minutes, I would like us to just go to the final bits of it so that we give other people to present. So if you could try to wrap up kindly, but I don't want to stop the presentation. It's very interesting, but try to just rush through at this point.
Okay, thank you so much for the reminder. Yeah, so in short, a number of challenges do exist, and I interacted with the parents, and they provided recommendations which they felt would help them access these assessment services amidst of climate change. You can shift, or you can go to recommendations so that we can conclude. Recommendations? Okay. Now, what should be done to ensure that you are not affected in one or the other in terms of accessing disability assessment for our children? Number one, there is need to form and strengthen community disability identification team. This will help the parents not to worry about who should provide information to do with assessment. And it will also help them to reduce moving from one point to another. So teamwork within the community where they're found needs to be implemented. The members of the team needs to be trained in terms of disability identification, which will later on result into referring a child for further diagnosis. Also, sensitization is needed because sometimes information is being missed by parents because of the changes that are occurring in terms of as a result of climate change. There is also need to have one-stop center for the assessment process to move fast. as I've stated earlier on that we have got 3 centers and parents have to move close to make the assessment process to come to a conclusion. There is also need to capacity build teachers who should also be in the forefront doing identification of these children, as thereby recommending these children or referring these children once identified for further diagnosis, either at UNZA or University Teaching Hospital or ZAMISA. Also, there should be an effort by road development agents to construct climate resilient bridges that would withstand the effect of climate change. As you can see that the first finding was that sometimes parents miss assessment services because of roads which have been disrupted. So those were many of the recommendation coming out of the parents. Due to time, I would like to end here. Thank you so much.
Thank you so much, Ben. That is a really interesting presentation with real time and really issues that are not really easy to connect the dots, but I think from how you have explained it, it's now very easy to understand that climate change is directly or indirectly affecting access to health, and the way you have brought out this issue of the child assessment, mothers in rural areas and local, the villages not being able to make time or access health facilities because of climate-caused problems like infrastructure, lack of capacity in the institutions and all that. And also, you brought out the issue of working together as institutions to kind of solve this problem. Really, really interesting, and thank you very much for sharing with us. I'd invite anyone who has a question or comment for Bain to post it on the chat. And the way Dr. Musimi has done very well to respond to the questions coming on, Bain as well, if you could take on that chance to interact with participants on the chat, that would be really, really good. I want to move on to the next presenter, and I also remind the presenters to move more and emphasize on the findings and recommendations, if possible, so that we may take the shortest time possible. Edna, are you ready to go next?
Yes, please.
Good. I think I have your presentation. Coming right up the moment. Okay.
Okay, so hello everyone, and thank you, ARIN, for this opportunity. My name is Edna. I'm a GIS analyst at StatsPeak and also a final year student in JQuat. So this study is about analyzing the impact of climate change-induced food insecurity on maternal health in Kajiado County. Next slide, please. So this is just the contents. Next slide. So Kajiado is part of the arid and semi-arid lands in Kenya, which experiences droughts. And when droughts occur, there is the health of vegetation and also crops. And since it's a pastoralist area, the livestock are also impacted in terms of the health of the pasture. Next slide, please. So this is just a brief overview of the study area. Next slide. So the objectives were to evaluate the drought severity using the Vegetation Health Index, and also to analyze climatic variables and assess their patterns, and then to find the relationship between the drought patterns and the malnutrition indicator cases. Next slide. So this is just a slide showing the data sets used, mostly satellite imagery and also malnutrition indicators from Ministry of Health. Next. That is the methodology from acquiring satellite data, the climatic variables, and malnutrition indicators, and the results were the drought severity maps and the graphs. Next slide. So the first step was to obtain agricultural and grassland areas in Kajiado County, and then also create a temperature condition index map, which just shows the different areas variation in temperature. Then the vegetation condition index, which is based from the normalized difference vegetation index showing the crop health, and the temperature condition index to produce the vegetation health index map, which shows the health of the vegetation, and then from which the drought severity map is derived. Next slide. So this is the map showing the different drought levels, their distribution, and also a pie chart showing the percentages with severe droughts covering most of the area in Kajiado. Now this was between 2020 and 2022 drought period. And then there was no mild drought, and to some extent there was moderate and extreme droughts in Kajiado. Next slide. So this is just a graph showing how different wards experienced the drought, with the Antoinette or Lankism ward having the highest, being highly affected in terms of the severe and extreme droughts, and then some wards were not that much affected. Next slide. So these are just charts showing the trends in NDVI. NDVI is used to show the crop health, and then temperature and precipitation. So when we have low NDVIs, it means the crop health is poor, which is brought about by high temperatures and low precipitation values. Next slide. So these are just visualizations showing the trends in the anemia, stunting, and malnutrition cases from 2020 to 2024, with a high peak in 2020 March for the malnutrition cases and 2023 for the stunting cases. Next slide. So this was also another index based on precipitation and evapotranspiration to show how drought patterns were between 2020 and 2022. So we can see that towards the end of 2020 and at the beginning of 2021 there was some drought, and also at the beginning of 2022 and towards its end. Yeah. Next slide, please. So the conclusions is that we can use different indices to assess drought, and the trends in malnutrition indicators, stunting, and anemia can be related with the drought patterns, as we have seen towards the end of 2020 and beginning of 2021, the drought patterns, and then it's not like the cases will manifest instantly. It's something that takes time to manifest. I mean, if some expectant woman does not have access to nutritious food, the child will also be impacted in terms of maybe low birth weight or later in the development stages, which may be manifested through anemia or stunting. Yeah. So the study can be improved by integrating machine learning or AI with GIS technologies to create real-time drought monitoring systems, and also the data on these malnutrition indicators can be collected at a disaggregated ward level, so just as to help in targeted interventions. Instead of generalizing the cases or the drought severity, this study can be used to tell the decision makers that this is the specific ward that has been affected and these are the cases at that specific place, instead of generalizing. Yeah, so that's all from my end. Thank you.
Thank you, Edna. That is really a good presentation showing how climate-related issues or climate can directly impact, or drought being one of the direct impact of climate change can cause health problems, and the way it can be mapped out and looking at comparing different areas as you have done in the Kajiado County. Really good presentation there. Thank you very much for sharing your work with us. Also, anyone with a question for Edna, kindly post it on the chat and let us try to interact with her as we move along. I'd like to check on Jamlik if you are ready.
Yes, I'm ready for it.
Okay, let me just pull out your presentation.
Can I share from this side?
Let me share it.
Yeah, I think I can.
Okay.
Okay.
Okay, just go on and share it. No worries.
You can view it?
We can see it, just put it on, yes, we can see it. Go ahead.
Thank you very much. Yeah, my name is Mwangi Jamlek, and from Meru University of Science and Technology, and presenting for you a review study on the chlorpyrifos pesticide effect on microbial dynamics and effect and activities in maize cropping systems. Welcome. And to start with is to understand why this kind of study is due to feeding of the whole nation and the whole world, where we know that the current population we are in the world, we are at around 8 billion, and by 2050, we are going to hit around 9.7. This means that we have to have increased population, we will demand for more food. We should, of course, for intensive modern agriculture, creating attention on public health, resource use, and environmental health. So to address the issue of sustainability in food production, we need to talk about the farming practices and the impact on soil microbiome, because we know that soil microbiome are the engine of many biochemical processes that happen in the soil. So soil is a home of billions of microorganisms, and they are affected by the farming practices, which include the use of pesticides as well as the cropping systems. And pesticides have a deleterious effect on the physiological and biochemical activities of the microbes. Unfortunately, less than 1% of applied pesticide reaches the target organism. And the pesticide residues are found in the human food, in water, in soil, and in air. And this creates the issue of human health as well as environmental health. I've gone through this. And why the maize issue in Kenya is that not only in Kenya and also globally, is that maize is the third most globally consumed cereal crop after rice and wheat. And sub-Saharan Africa, it contributes about 40% of the cereals. And the area under production also in sub-Saharan Africa is over 50% of the land. The uses is for human food, for biofuel, and for animal feed. And in sub-Saharan Africa, 80% of maize produced is used for human consumption. Maize production is faced by various challenges, both abiotic and biotic. And when combined, they have a big impact on the soil, on the soil biological, chemical, and physical characteristics, which now affect the microbial composition. And Kenya being a special country, we depend highly on agrochemicals to enhance productivity, especially of this crop you're calling the maize. To address the issue of fall armyworm, for instance, there's just one challenge that faces maize production is use of the chemical as well as use of diversified or mixed cropping systems. In terms of the chemicals, we have quite a number of chemicals that are used to control the fall armyworm, including the chlorpyrifos, we have the imidacloprid, we have the emamectin benzoate, just to name a few. Chlorpyrifos is one of the most widely used insecticide, and cropping system is also one of the methods that is used to address or to manage these challenges, especially the fall armyworm. If we look at the monocropping system, this is an agrochemical demanding practice that have effect on nutrient use, water use efficiency, biodiversity, and soil functional microbes reducing. On the other hand, is that monocropping causes the increase in soil-borne diseases, the soil erosion, and the soil degradation. To address this, we can talk about the mixed or diversity cropping system, which creates a synergistic approach where it reduces the soil-borne diseases, the soil erosion, and the soil degradation. That happens, it creates a very good soil condition, which enhances the nutrient cycling, water use efficiency, the biodiversity, the soil functional microbes, and the soil health and fertility for improved crop productivity. The objective of this study was to review the effect of chlorpyrifos on soil microbial structure and functionality in maize cropping systems. And then why maize? Why chlorpyrifos in farming systems? Chlorpyrifos has been used by farmers injudiciously, causing negative impact on microbial structures and the functional genes. These impacts on microbial stages and their activities are difficult to predict. This calls for a need to understand these effects on chlorpyrifos on the soil microbes and their contribution in affecting nutrient cycling, water cycling, greenhouse gas emissions, and general environmental health of the soil, as well as the other ecosystems. And this combined with the diversified farming systems will enhance soil health and the soil fertility for sustainable productivity. The methodology for this study was through conducted a comprehensive review of existing literature and do a meta-analysis to synthesize the findings on how chlorpyrifos insecticide affect the microbial structures and functions in farming systems. Just to appreciate a future review that was cited, and their findings is that chlorpyrifos are noted to affect the microbial structures as well as their activities in the soil. The results showed that continuous application of chlorpyrifos interfere with the microbial structures and enzymatic activities. First is that chlorpyrifos can be broken down by microorganisms within 2 days or 7 days, but now the continuous application creates a dense or a more contaminated soil, and this one have impact on the bacterial, the fungal, pneumycetes population. I have not shown for the one for the arachni population, but have the same trend that at low concentrations, the colonies are not so much affected, but as we increase the concentration of the chlorpyrifos, the impact on the number of colonies continue to decrease. Each at every increment, can see from all the control that there was no application of the chlorpyrifos to about 1,000 parts per million, that the colonies were highly reduced. For this is that they affect the microbial stability in that it can react either by microbial becoming resistant, they can be resilient, or they can have what you call the functional redundancy. In this case, they can increase the microbial, or they can decrease them, or they can remain. And this affects the microbial processes in the soil, especially the hydrogenation, the ammonification, and the nitrification. This one are highly reduced. And the nitrification process is highly increased, and this results in affecting the soil health and the soil fertility. It was found that a various portion of the microorganisms are not yet identified. To identify for these microorganisms that contribute so much to the soil health and soil fertility. For recommendation, one of them is develop and implementation of policies on effective use of pesticides. 2 is to have a collaborative research and communication of the findings to all the stakeholders, that is like the farmers, the policymakers, and the other stakeholders. 3 is to do the capacity building of farmers on sustainable and safe food systems. and 4, maybe promoting sustainable agricultural practices, especially the use of agroecological practices that can call for use of bio-based products. Can you have the mixed cropping and the mixed farming, incorporation of agroforestry in our farming systems, as well as incorporation of indigenous knowledge in the farming systems. For conclusion, is that increased use of pyrophos negatively affect microbial structures, and this have effect on the native activity of the microbes, and this deplete the cell microbioenzymatic activities, which severely affect the mineralization and cycling of the nutrients. And this causes the loss of soil fertility, hence affecting the productivity of maize crop, among other crops. Just to cite a few references for that. And thank you for listening to me.
Thank you. Great job, Jamli. Thank you for your presentation. Very well, bringing the aspect of farming practices and how this affects food structure, emanating from the microbial structure as well, the nutrients, the biodiversity at large. But maybe before you go, and maybe a question I have for you that I've just picked up, something I've picked up. Are you able to kind of relate the farming practices to the climate change as issue that we're trying to interrogate? Because this is very pertinent. The food we consume and the way the structure of microbiome is affected. But are you able to tell us something about how you can link your research directly to climate change from the farming practices side of your study?
Yes, thank you for the question, and for that clarification is that this study is that the farming practices, one of them being the use of the farming systems, such as the use of pesticides. They affect the microbial composition, the microbial structure, and the microbial enzymatic activities, which now contribute to the greenhouse gas emissions. The soil is a sink as well as an emitter of greenhouse gases, and these greenhouse gases have big impact on the climate change. So the effect on the microbial activities have by application of the pesticides will affect the microbial abundance as well as the composition of the activity, which will also have an impact on the greenhouse gas emissions, which contribute to the greenhouse climate change. This also have impact on the health of the human. The residues that are left by the pesticides have an impact on, they have been found on clouding the microbial activities. The pesticide residues in food systems, in water systems, and also in the soil systems and the air systems, which have impact on the human health. So the whole network is that the microbial plays a very big impact or role in cleansing of the systems. Thank you.
Absolutely, Jamli. Thank you very much for that clarification. I see there's questions, very interesting questions coming through for you on the chat section. So I'll invite you to interact with them and respond to them on the chat as we move along to the next presenter. But this is a very timely presentation. I think just putting it loosely, we try to, and I think generally the general public tries to link the proliferation of cancer issues, outbreaks and all that to what we consume in our food system. So yeah, this is very, very interesting. So thank you. I'd like to invite Dr. Ndejo to make your presentation. Dr. Ndejo, are you present? Good. Please go ahead. We can see your screen, just put it on presenter mode, then proceed.
Thank you. So my presentation this afternoon is really looking at how can we learn from districts that experience extreme weather events as we build climate resilient health systems. So we are moving away from we are moving towards the big picture of thinking about systems and policies and where we are with our health systems, with some lessons here from Uganda. This is a point that I do not need to emphasize or make, especially at such a gathering. I guess we have discussed a lot about climate change and what is happening across the globe, but also what is happening in Africa, but also even here in Uganda, where we are now reporting more extreme weather events that are attributed to the changes in the climate system. So in this study, our interest was to assess how extreme weather events were impacting the health system, but also explore adaptation mechanisms in these 3 districts. The 3 districts where we did this work are Moroto district, which usually experiences floods and a drought. We also did this work in the Bududa district, as you can see them in the different parts of Uganda. Bududa is renowned for landslides, then floods and also drought. And then Kasese district has also reported landslides, floods, and droughts. So we wanted to look at how these districts have been coping with dealing with these extreme weather events, so that we can document some lessons that we can take away as we try to build these resilient health systems across board. So this work was mostly informed by key informant interviews. We interacted with several informants. Some of them were decision makers, some were local leaders, some programmers at different levels, the community level, the district level. We also obtained some perspectives from the national level to try and understand things from the bigger picture. We analyzed a lot of these interviews, guided by the World Health Organization operational framework for climate resilient and low carbon health systems, which also informed how we presented our results, which we supplement with participant quotes. So we'll get into a bit of the results. In thinking about our results, we organize these according to the building blocks of the health system, which are 6. So the results will follow those 6 building blocks, and then we'll see any other issues that came up. So we started by trying to understand how the extreme weather events usually impact health system leadership and governance. And when these events occur, of course, there's a bit of confusion. There's a lot of partners coming into play to respond to these events. And all these processes result into conflicts, a lot of interests, political and non-political health interests, which are usually hard to manage, but also issues around coordination of multiple players that also arises. So in terms of adaptation at the leadership and governance level, some of the key interesting feedback lies around trying to have a clear policy framework and being able to clearly delineate the role of the health system in responding to these events, which was mentioned as key. In some of the districts, there's decentralization of disaster management committees up to sub-county or even lower levels. And this also supports the aspects of preparedness at the health facility level. One key interesting aspect was also the mapping of partners in advance and trying to understand their functions. And this reduced the time or the response time in actually reaching out to partners and knowing exactly which partner deals with what and how they can be able to support the response. In terms of the health workforce, a lot was reported, including injuries or deaths to health workers. Sometimes they're unavailable, they can't reach facilities. or they are not able to attend because of illness that is orchestrated by the extreme weather events. Workload increases because even demand for health services increases, but also broadly impacts their health and well-being, including their mental health. So what is currently happening in some of these districts includes capacity building and training of health workers. There are several lessons around incentives. How do we build the health system in a way that it actually favors health workers who work in such areas? Some of them are really hard to reach areas. Can we provide accommodation, transport, or additional allowances? But also thinking about empowering lower level health units so that their capacity is strengthened and that they can offer additional services. Issues of psychosocial support to health workers and also closely supervising them also arose. Then health systems, health information systems, of course, everything gets disrupted, whether they are reporting systems, the quality of data sometimes is questionable, sometimes the influx or migration of communities also impacts estimation of statistics, which were some of the broad issues that happens at the facility level. And a lot continues to happen in terms of developing and improving some of the early warning systems, improving surveillance systems to ensure that they can improve monitoring and tracking of disease outbreaks. Some of these are usually even a result of the impacts of these events, and also broad issues around community engagement and trying to work to create innovations, but also see how to support their uptake at the health facility and health system level. So those are about the building blocks of the health system. An additional three were one, infrastructure and commodities. Generally, loss of infrastructure or medical products was reported. Because the increased demand for supplies because of the high demand for health services. Also, I think broader infrastructure is affected, so delivery of supplies becomes a problem to these facilities. Ensuring that there are some drugs stored within the district stores was mentioned. That increases their availability, especially during emergencies. Thinking about climate resilience designs, this is an area that is emerging. How can we strengthen the infrastructure? How can we improve the materials that are used to reduce the impacts of these events on the infrastructure at facility levels? Broader allocation of facilities also matters. Can we think about safer areas among several other aspects? In terms of delivery of services, we have mentioned aspects of increased demand for health services. Referral systems are broken down. The quality of care sometimes is reduced. On some facilities actually degraded. We have had a case of where a hospital was degraded to a much lower level, especially because its infrastructure was impacted. Several adaptation mechanisms in terms of thinking about improving energy supply, safe water to facilities, so as to support continuity of services. Aspects of outreaches, upgrading facilities, I think I've seen that, but also trying to think in advance and designate facilities. Financing is always very important, but when we have these events, of course, a lot of districts report a depletion of their budgets to deal with these extreme weather events. And then they have additional pressure to mobilize additional resources, which is usually not easy. The area mapping of partners helps so that they can reach out to them and see who is able to provide some funding, who is able to provide some additional technical and other resources, but also think about budgeting, anticipatory budgeting, trying to see how to integrate climate change planning in some of the health budgets. So those are the broad impacts and adaptation mechanisms we have documented from these districts. As we start to think about concluding, these are just some supportive quotes for us to further appreciate. One talks about how they do mapping for those who respond to emergencies, but also map partners who would be able to support normal programming. This lesson came in from Moroto district. We also have still this is another quote from Moroto talking about early warning systems that they have within the district, but also how they try to strategize, especially through the district disaster management committees, to identify risks early and then strategize, and also involve the health office in a lot of these discussions so as to try and plan in advance. Another quote here from Bududa district. This person noted that they're usually very mindful of areas that are hard to reach areas or places. So they try to plan for aspects of staff accommodation, and this reduces the need for health workers to commute every morning or every evening, and also ensures more availability of services and continuity because some of the health workers are actually around facilities. And in Kasese, they also mentioned that they try to maintain drugs, especially those that would be needed in case of emergencies, so that they can ably respond much quicker, even as they wait for the central level government to provide support. The last slide talks about some enablers for building climate resilient health systems based on this work. A lot of them have been mentioned, whether it is a clear policy framework, whether it is the political will, having resources is also quite key from what we saw, the availability of health workers and also their technical capacity. Think about efficient supply systems so that even when a supply of medical products is interrupted, we can at least be able to ensure that some of the supplies still reach facilities, surveillance and early warning systems, the high level of community engagement, and building a strong community health system that can support and try to support provision of services, especially during the critical times. Also think about how can we clearly monitor and inform our evidence. So in conclusion, I think this work is just trying to share a bit of evidence around how health systems are impacted across districts that usually experience extreme weather events. We have also highlighted a bit some of the measures that these districts are taking across the building blocks of the health system, which we think should really be important in terms of how we think about restructuring our health systems for resilience to climate shocks, but also broadly thinking about how can we support our health systems to be able to anticipate, to respond, to cope with, but also recover from these events. By learning from districts that routinely experience these events, so that those that may experience these events in the future can also start to prepare and know what works and what doesn't work. So just to appreciate all those who have contributed to this work, including those from the districts, those that we interviewed, the broad research team, but also the fund Alliance for Health Policy and Systems Research. Yeah, that is it, and back to you.
Thank you very much, Dr. Nejo. That is very interesting research from a case study from Uganda. I really like the way you have brought the elements of how to build climate resilient health systems. I like the way you have something that hasn't been spoken about a lot since we began the conversation, monitoring and evaluation systems of how we have been approaching things in future to help us to kind of analyze and learn along the process. This is maybe I'm just a bit biased towards monitoring and evaluation. I like that you've emphasized early warning systems. They need to be robust, they need to be very clear. The political frameworks that are really incorporating community engagement, that is also very key. And I'm happy that this is also happening and coming out very clearly in Uganda as well. Thank you, Dr. Ndejo, again. And if anyone has a question for Dr. Ndejo, kindly engage him on the chat so that we can move to forward. That was the very last case study presentation. And I think we're right on time, and I'd like us to switch gear now and just move on to our panel discussion, where we have experts who are going to delve much more into some questions related to today's topic. So far, so good. If anyone has a question or comment that is popping in, please just ensure that you bring them out. Just leave it on the chat, and we'll come back to it at the end of the panel discussion. So I'd like to invite our first panelist, Dr. Catherine Machalaba. I presume you're here. I saw you earlier, and I believe you're still here. Catherine, just give me a nudge if you're here. Dr. Machalaba? I think I saw you. Yes, there you are. Thank you. Thank you for showing up. So I'm going to invite Dr. Machalaba, and who is a planetary health scientist based at the Nature Conservancy. And her research and policy work focuses a lot on the intersection of biodiversity, climate, and health, and the role of One Health strategies in health protection. That is very important. I think we are going to benefit a lot from your expertise in that area, Dr. Machalaba. And the question we have for you today is, in what ways can collaborative research platforms and networks such as this one, how can they be optimized to facilitate data integration across diverse disciplines and geographical regions? I believe that was the question that you prepared for us today, and I'd just like to hand over to you to take it over.
Thank you so much, and thank you for the opportunity. I think this conference is incredibly important, and I really want to celebrate what I've already heard in the discussions and the presentations, because I think that detail, that precision, that bringing together these different disciplines, I've already heard some disciplines at the table that I really haven't seen before in the climate and health space. So I think this is a tremendous start, and I really want to celebrate this. And I will bring in the One Health dimension, which I think complements what's already been stated. And it also reminds us to bring a few additional stakeholders to the table. It gives us some working mechanisms that we can leverage to really amplify the work that we're already doing and make it more routine. So I'll give a few examples of that. I have a few slides to share. Hopefully you can see it. I may have a little technical difficulty. Let me just see if I can get this on the screen here. I think so. I think you can see it now.
I can see it now, yes.
Okay, hopefully it will advance correctly. Hopefully you're seeing a lot of different documents. Okay, great.
It's up there, yes. Yeah.
Excellent, thank you. So, I think the good news is there's a lot already happening, and this is really exciting in terms of, we don't have to start from scratch. There's a lot of knowledge synthesis that's already being done. Of course, that's highlighting where we have research gaps and research opportunities. I would say that there's still a big divide in terms of how these networks operate, and you can see some of these processes that are really robust, like the Intergovernmental Platform on Biodiversity and Ecosystem Services. Of course, climate and health are really at the core of that if we really think about those interactions. There's a big Nexus report that's coming out, I believe, on December 17th, that we need to be looking at in terms of understanding the connections between health, water, energy, and of course, how climate change and biodiversity loss are affecting that, but also the solutions where we can really look to climate action. I think, there's a lot of these different synthesis reports. And again, as we bring our expertise to this space, seeing what's missing also. So social sciences, of course, are very important. Many different dimensions of how we can be interpreting these findings, additional knowledge points to bring in. And I think all of these different networks, I know we've seen a few of these already. I think Afrohoon will hear from an expert who's really leading on the training and research and bringing together different disciplines within the university network. but really how we can all bring our collective strengths. And I think the fact that this conference is bringing many of us together is such a great starting point, so we can continue this dialogue, share the outcomes, and also remind others that maybe there are additional perspectives that need to be coming in. So I also just want to say, I think a real opportunity, but sometimes challenge for these networks is making sure that really what's happening at the local level is then reflected. We don't want something that's only top down. We of course need to really hear the context, the diverse views, sometimes the different priorities that are shaping decisions on the ground. So I think as much as we can keep that into perspective, I think the great presentations that we've heard and the case studies have really done that, and our different associations and really different entry points bring those views that we always have to be keeping in mind. And that might be why we're not seeing sometimes the actions we would expect from policy decisions if we don't adequately include those important voices from the community, from the ground. So I think this is where the One Health approach really gives us an opportunity. And I want to just look at the inclusive definition here, because again, we're trying to reflect this then in networks like AfroHoon, the One Health University networks, and really at these national levels when we're thinking about strategic plans, which I'll talk a bit more about. But you can see it's very broad. It has this shared adoption by these 4 intergovernmental agencies. So if we think about global level and regional level action, there's this common understanding now that we're really working toward. And we can think about the different sectors and disciplines that need to be at the table. We can think about different levels of society. And then these outcomes that we're working towards. So certainly human health, but also healthy animals, so domestic animals, wild animals, and then healthy ecosystems and how they're all connected. I want to highlight in the center here these tools, these 4 C's: coordination, communication, collaboration, and capacity strengthening. I think these are things we know are really important. We need to make them more routine in terms of how we do our work. And again, I think if we bring in these networks that we already have in place, if we then link them more to let's say the field epidemiology training programs, for example, really key expertise that's supporting work on the ground, building capacity, looking at very local and national and regional in some cases issues. What can we learn from working together and training together and really building that knowledge base together? So again, these great tools that we need to really be thinking across disciplines so we see the connections. I want to give a few examples from practice from the past 15 years that I've really learned from in terms of linking up and data integration. So this is just a snapshot, but some key success factors that I think we've really learned along the way. And one was on Rift Valley fever. This was a 10-year project in South Africa, and there were a lot of different partners involved. I think this was really exciting to see how the project started, how we thought we had the relevant disciplines at the table, and we really saw very quickly that there were additional considerations that we needed to really have part of the project to understand the full context. You can see here the different components. I think having that flexibility was key. So something we didn't envision as being so important at the beginning was soil science. And if we just heard a great presentation from a colleague talking about the microbial aspects of soil. We really saw the importance of this when you think about the mosquito vector and actually how it's able to survive over time in drought conditions, then what happens in flood conditions. So really thinking about soil and vegetation, also thinking about early warning systems with weather patterns. This is really a climate sensitive disease, so we can learn a lot from working together. Now, this really required, I think, very sophisticated data integration. So we heard earlier, I think it was Dr. Wright who mentioned about the data components and data management. And so the value of having a data scientist in the project, bringing together these different aspects was really useful. it's not always possible in every project or every network. So I think a transferable, best practice from this project was having an annual stakeholder meeting. You can see a picture from one of the meetings. This was really held every single year, sometimes more frequently at the local level, bringing together farmers, for example, but at the national level, bringing together the red meat producers, for example, who really had a vested interest, the wool producers who had a vested interest in reducing the risk of Rift Valley fever, risk and impacts. And then really thinking about the different agency involved, veterinary services, environment, public health, and many others, and these different aspects. And, I think it was great because we could see the progress made in each of these different areas and the key takeaways. So we didn't have to know all the data. I had an economist role in the project. And, I really got to see the different dimensions that were so valuable and the key takeaways, and that really informed my work. So thinking also about what different levels we need to have information and that knowledge integration piece. So making in a project or in a network these really routine ways of coordinating, of sharing findings, and then coming up with common solutions. Then we heard about early warning systems from another presenter. I think it's really exciting too when we think about regional opportunities, the value of having information, but also knowing how to use it and when to use it, and thinking about patterns like migration, how people will move, with themselves, and with their families, but also with their animals, what that means for disease risk, for example. What can we learn about then pressures on the natural environment, resource needs, water, grazing area, and then how that may affect our ecosystems. So thinking really, I think, proactively about what we need to do now, but also into the future and how we can get ahead of risks and really be very prepared and reducing risk. Now, One Health coordination platforms, I think, are really a key opportunity for climate and health. Many countries in the continent are setting up these platforms. Some have really been around for now 8 years or so. There's been a lot of lessons learned along the way. Liberia, for example, is now, I think, into its second governance manual, with really setting a course for how to meet regularly, share information, in some cases do joint vaccination campaigns, really getting into the habit of working together. And some now strategic plans are coming together. Very exciting to see, many of them including climate. I think this is a key opportunity for climate scientists and health scientists, animal and human health scientists, and many others to come together and make sure we're thinking about the risks of climate-sensitive diseases, how we're thinking about, for example, critical infrastructure, like we heard, our health systems at risk of flooding events, for example, and then how that will affect our ability to provide for health services today and tomorrow. I really want to highlight also the rural dimension of this, because as we know, rural access to healthcare is very challenging in many parts of the continent. And we really need to be thinking at the local level too. And I think it's very exciting to see many countries now looking into setting up county level One Health coordination platforms. I know this is happening a bit in Kenya, also Liberia, and I think other countries are looking at this as well. So a key opportunity. And I would say we have seen less so of the climate change mitigation and adaptation planning. I think a lot of these coordination platforms have been more focused on disease response, a bit of preparedness. How can we really be thinking now, this next phase of One Health coordination platforms, about the environmental dimension and what are we doing to mitigate and adapt to climate change? And this goes beyond infectious diseases. We can really think about non-communicable diseases, many different aspects, nutrition, for example, water availability, water safety. And I think it's a great opportunity to bring together these different disciplines. Now, I want to highlight an example that I think is really exciting, the Nature for Health program, this new initiative that's just starting out in the past few years. And the Secretariat is at the UN Environment Program. So bringing together climate, biodiversity, action for health, And the first tranche of funds is really focused on pandemic prevention and addressing the root causes through systems thinking. We are just completing a scoping phase where we're really bringing together different stakeholders at a country level to look at what are the issues, you know, and what are the different perspectives, and then design projects based on that. There's a great scoping guide. I hope you'll take a look. It's online and I can share the link. But I also really invite you to check out this opportunity to get involved in the next phase. And I think this is a great network in terms of sharing lessons learned, really building up the environmental dimension of One Health platforms so they can contribute fully to health, and working together, sharing across countries through this mechanism. This is a lot of different partners involved, as you can see. And really as a global initiative, we can be sharing what we're learning, how to do things differently, and really looking towards the future to protect our health and our environment. Now, I'm really proud to have just joined the Nature Conservancy. I'm really excited for this opportunity to bring health into conservation, and have already really seen that the Conservancy is doing so much that is relevant to health, including in the continent. And I am really excited to see how we can work together to optimize our collaboration towards the Nature Conservancy's goals, which of course are really aligned with the global biodiversity framework and where we need to go to protect our planet and our health. So very keen to hear how you think we can contribute to these different networks that you're all working in, how the conservation community can be useful to your objectives, how we can share information. So I would really invite a dialogue on how we can do that together, certainly at the regional level, but also then globally in terms of best practices and lessons learned and data systems that we should be bringing together, looking at these different interfaces for climate, for biodiversity, and for health. So I think I will stop there to just say, you know, we have a lot of these mechanisms in place already. I think it's a matter of just making coordination routine in some senses. You know, we do need resources to help us integrate data and make that really available and systematically enabling us to utilize functions like early warning systems. But at the same time, sometimes it is just sitting together and sharing, you know, our insights and looking at, okay, what are the dimensions of an issue like Rift Valley fever, a climate sensitive disease? What are the different dimensions and what are the relevant solutions? And I think we need to do that certainly at a regional level. We also need to do that really at a local level. So I think the work that everyone is doing is really on the right track, and it's really embracing how we continue to come together, share insights, and also look into the future about collaborative research projects that ensure the right disciplines are at the table, and that flexibility is also built in to allow for that continual learning and seeing, ooh, maybe there's another sector or dimension or stakeholder that really needs to be part in a meaningful way. So I thank you so much for the opportunity.
Thank you very much, Dr. Matalaba. That is really, really amazing to see your work through the One Health platform, giving us, you know, real examples of how the strategies you have applied to ensure that you're coordinated within the region, and the data sharing part coming through very clearly. And I really like what you have outlined. I pick up really the 4 C's that we have been talking about through, but I think they need to come out very clearly when you want to see how we can collaborate. In our minds, yes, we know what to do, but we just need to implement, as you have concluded your presentation with. We need to communicate more, we need to collaborate, we need to, you know, capacity build within our systems and organizations. And in that way, we are going to be able to link up together, and the things that we have been talking about, we don't know how to share data. I mean, it is things that are possible, but we just need to do and just implement them. And I think what you have also brought about the systems thinking, it was one of the suggested approach at one of the side events earlier on today. And I think it comes out very clearly because it's something that we need to embrace to ensure that we are working together, we are coordinating, we are sharing our data. And when you're talking about how we can add value as individual experts to ensure that we can carry on joint risk assessments, we can apply the data early warning system has been discussed very extensively, but when we're using systems that are kind of coordinated and we are able to monitor and evaluate in our work, and we're able to sit down and just think as a network, as experts together on the table, how has what we have done, is it working, is it not working? So I really think that all you have said comes out as, you know, everybody is thinking the same way really clearly, and we can see it straight on from your work and experience. So thank you very much for sharing that. It's really, really helpful. And I know there'll be questions coming directly to you, so if you could just you know, stay along so that if anyone has a question directed to you, we can just post it to you. So thank you again very much. I want to move on to the next panelist, who's going to call. I've seen Raymond. I think of Raymond Ryoka. I have seen you somewhere. I hope you're still with us. Raymond, could you indicate if you're still with me?
Yes, I'm here. Thank you.
Oh, great. Thank you. Thank you. Welcome, Raymond. Just to introduce you, Raymond. Oh, sorry, some interruption there. Raymond is a Ugandan leader, is a founder of YADNET Uganda, and it is a coalition of so many NGOs, over 145 NGOs, and he's also the regional director of YADNET Africa. This is a network that is coordinating 285 organizations across 15 African countries that looks at economic empowerment, environmental conservation, and climate resilience. Really, really big hat you're wearing, Mr. Ryoka, and we are happy to have you. And the question that we had prepared for you that you're going to address in this panel, we want to see from your experience, how can indigenous knowledge and local perspectives be integrated into transdisciplinary research to enrich our understanding of climate change and health in Africa? In your experience working with this vast network that you're coordinating, what is the role of indigenous knowledge and how local perspectives really ensured when we are kind of consolidating the voices? So welcome, Raymond. The floor is yours.
Yeah, thank you very much, moderator, and thank you very much, the panelists and also the previous speakers. One is to first appreciate and congratulate ARIN for this milestone for this conference, but also it is a rejoinder in relation to that the upcoming COP29 processes emanate on this agenda that this conference is going to get up, in that as we engage governments in the next 1 week and on so, then the focus for climate and health research is put at the fore. I wish to project my screen. Sorry, I hope you can. Can you see my screen?
Yes, you can see it.
I want to speak in relation to why I'm here and talking about indigenous knowledge and local perspectives, but also I wish to inform you that YADNET Africa is a member, is a host at the same time of Africa Climate and Health Alliance. That's the alliance that will bring NGOs in Africa from different countries to advance the regional climate and health agenda. And it has been fully registered in Uganda, the government of Uganda, and working with other partners in different countries. So, that's very important for this discussion to so that we're going to strengthen research, but most importantly, our agenda is going to ensure that by 2030, Africa has a Center for Climate and Health Research, that a one-stop hub for this. In addition to what you mentioned, I wanted to introduce what Archer Africa, which is the network we're talking about, alliance for bringing partners together, and that is our mission and the vision. So, being part of this space is paramount for ensuring that we advance climate and health research in Africa, and having a one-stop center for data on climate and health that is locally generated, indigenous in nature, is very paramount for this. So I talk about indigenous knowledge and local perspectives in the face of climate and health. It is important that we also synergize on what are we doing at in the space of working. Earlier on, Catherine has mentioned much about about One Health, which I want to re-echo, that we are speaking here basing on the agenda for One Health, that all governments are going to comply, and definitely talking about human, animal health and environment together is very important. And we're talking about it in the face of indigenous knowledge and local perspectives. It's understanding how to ensure that we integrate this in the local practices, and also ensuring that everyone is not left behind in the space for making the health sector and the lives of communities climate resilient. In addition to which talking about more about the nexus and how it's important that we need to looking at communities and indigenous knowledge therein to ensure that we overcome these climate sensitive health risks and the vulnerabilities therein, which are very important for our discussion. So I talk about indigenous knowledge. First, to understand what we mean indigenous knowledge. Of course, being a collection of knowledge and practices, and these are the culture and society and groups. But in the face of climate and health in the space we're talking about how these communities are affected by climate, and what is the role of us in relation as research to strengthen data generation and knowledge management therein. So integrating indigenous knowledge and local perspectives into research and climate in Africa can help develop more effective climate policies and actions which are community-centered, but also being owned by these communities therein. I tried to get only 7 areas of focus, which I think are very key, that I will share with the team here in the face of discussing about indigenous knowledge and the local perspectives. And these 7 elements, which I thought are very paramount, we also help on ensuring that we amplify the voices from vulnerable communities, because climate change affects more those at the grassroots, because they are the hotspots where looking at the impact being felt. So it is imperative we look of improving, strengthening those areas of indigenous knowledge generation, but also being cognizant of their role in society. Picked areas of focus that we think need to put emphasis on, and areas that we need to look at, not to leave behind, as we do advance the nexus and ensuring that this knowledge is amplified in the space of climate and health research. And these areas can be both within the sphere of environment, the sphere of medicine, and in the sphere of community development. So personally, as a public health specialist, what does it mean to us? Generating local generated technologies and those interventions that emanate from there. So these areas, 7 of them, which I think we'll share with you, will be to kind on what we think the role, what can be done to ensure that these indigenous knowledge and local are integrated in this research you're talking about, and what should be done. The first element, which I think is very important, recognition of their indigenous rights. Recognition is very paramount, as it should be the game changer in ensuring that you're going to develop climate and health research, recognize indigenous knowledge and indigenous entities and innovation is very paramount, both at land, human health, and environment. So in those spaces, respecting and recognizing them, and these cultural perspectives and in relation to cultural and health services access is very important for environmental sustainability. The other area I thought is very important is the involvement. Which looks at dynamics in relation to effective participation, but also inclusive involvement. So we believe that indigenous people as key players in climate planning implementation, this can be an important element of ensuring that we have effective solutions, and the solution generated by the communities where the indigenous knowledge is. So as you think of developing climate and health research in the parameters in your respective area of focus, it is imperative that you involve deeply, but also meaningfully, and also ensure that they are at the fore of discussion. Capacity building, it has no say, because it's the engine for ensuring that communities are able to generate adequate and quantifiable data. So building the capacity of rural communities and government agencies, especially local governments. I'm happy listening into Dr. Lawrence, listening Catherine and the others, talking about what is important and giving these spaces from the districts and areas where they operate, areas that are climate stricken, and they are sharing this information from there, the surveys and those that they're in. So it is imperative that we build capacity for their climate resilience to be realized. So it is strategies must ensure that they have components of capacity building to strengthen these communities, so that indigenous knowledge is geared with anchored on a basis for information, skill, and also segregation done as per. Co-production is also another area which we think can be a game changer in ensuring that this data is integrated in our climate and health research. Co-production, of course, working with scholars, and it's good that we have universities and high institutions, because they are the custodians of data, especially generating it and also ensuring that it is cascaded communities. Like we have heard from the scholars that we have here, local communities, and these were working together, and in the co-production processes, question how local knowledge fits into scientific frameworks is very paramount. Of course, we know that this process should be based on mutual learning, and also ensuring that you've already, as I mentioned, you appreciate what they are talking about, but also you have the power to empower, to ensure that the information you're going to generate, it has a role to change the status quo of the indigenous areas and the communities they're in. So it is imperative that that no group or any other sphere has power, issues of power dynamics, that everyone has a role to play, and therefore they must be respected. So co-production is very key, and ensuring that all rights are preserved in those space for climate and health research. So it is imperative that we think about having everyone on board, but also respecting them. The other area you talk about promoting indigenous channels and innovations to advance quality health in the climate and health research. So unless you promote this indigenous knowledge within our spheres of work, as whether you're researchers, whether you're scholars, whether you are academicians, or whether you are development partners, promoting indigenous innovations and those that emanate from these information get from the communities, will be a game changer in ensuring that the community health systems adapt to climate change. And we believe this is important in promoting research that will generate quantifiable data for the communities related to their health, but also looking at their health systems therein. Then the other one also, research and document indigenous health best practices in the face of climate. I'm happy that when you listen into the past presenters, they were giving information and data from areas that I call them the climate change hotspots. That's very important. That you talk about climate change hotspots, you have data generated from areas that are most vulnerable and have been affected by climate change. So in the same way, to conduct more research to bridge indigenous knowledge with difficult climate and health, it is important that you have that knowledge that is going to be generated from areas that are most stricken. And definitely through documentation and inventory of success cases, these indigenous knowledge and practices, the big grim avenue to inform policy, but also generating action research, and also designing interventions to address the challenges therein. Last but not least, which is very important, is collaboration and partnerships. So I'll talk about collaboration in this space. I was talking about that working closely with indigenous communities. Many times researchers go to communities, generate research, and they just leave, and nothing has happened basing on even giving feedback on the data generated therein. It is imperative you collaborate with indigenous communities therein, in that now they own the data generated there. So for us to effectively integrate indigenous knowledge in our climate and health research, it is important that we collaborate with the community therein. And this is one way of sustainability of these research interventions, but also ownership, in that at the end of it all, after a long time, someone can come and know that research was done here and this has been done, but at the same time, there is progress in addressing challenges that were realized from the research. So I thought these 7 elements would be key for ensuring that we effectively ensure that indigenous knowledge and the local perspectives are effectively integrated in the climate and health agenda. In conclusion, I think, and as I mentioned, many indigenous and traditional knowledge practices are rooted in the understanding of and respect to ecological systems. So they are the custodians of the data we're talking about here. So before you do anything, we think have them at the center. Let them be at the epitome of the research, but at the same time ensure that the information is respected. The other elements of efficacy can be part of ensuring that you make the data generated quantifiable, but more importantly, to achieve the goals or the Paris Agreement with effective participation of indigenous people, it is important that we as stakeholders, governments and government partners, put indigenous knowledge and the people and the communities at the center of the discussion. Thank you very much for listening.
Thank you very much, Raymond. That is really, really intriguing, and your knowledge of indigenous knowledge, the way you've expounded it, very, 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 very key. I like the way you bring out the respect and acknowledgement of indigenous knowledge, which is real. Knowledge that and practices that have worked, that are proven to be useful to the local communities. So respecting the boundaries and the territories that these people live in order for us to try and help address the issues that face them is very important. But most importantly, I like the way you bring out the fact that we need to research and document these practices, how they have worked. If we really want to incorporate them in our practices, we have to be aware of them. We have to kind of want to interrogate and understand their practices, and so that we may be able to collaborate with the local communities in order to address the challenge and health issues they face, and together as a region, as a continent, I think it will be really useful to move forward with everyone on board, as you rightly say. I really appreciate your presentation, and you still, I can see the aspects of co-production still very much prevalent in your presentation, as everyone has emphasized. So thank you. I want to also invite questions directed to Raymond. If you do have a reaction to that presentation, just put it and leave it on the chat, and we'll come back to it. I want to usher in the next panelist, Samuel Wanjohi. I think you're around. I would like to give you the opportunity to share your perspective on the area of translating research findings. If you're here with us, Samuel Wanjohi.
I'm still here.
Good, I can hear. Thank you. So Mr. Wanjohi is affiliated with One Africa Health University Network that is based in Kenya. He's very passionate about advancing the implementation of the One Health approach. And it has seen him participate in very many trainings, training students and professionals that include multidisciplinary staff from academia, government institutions on various skill sets, including risk analysis and One Health leadership within the East and Central Africa region. With that expertise and background, Mr. Samuel Wanjohi is coming to address the issue of research translation. So the question we had for him is, what are the most effective pathways for translating research findings into actionable policies and interventions that enhance climate and health resilience across Africa. And I see your presentation is ready, so kindly go ahead, someone.
All right. Let me see. Let me see if I can. Where's my video? All right. Thank you. Thank you so much, moderator, for giving me the opportunity to make this presentation. My name is Sam, like you've heard, from the Africa One Health University Network, Kenya Country Office. I think I want to appreciate this session. And essentially, if I was to do like a shortcut presentation, I'd say it is done, because by virtue of being in this particular session, the session that has brought together academicians, industry practitioners, and so on, I think it essentially answers the question of translating research to inform policy. So essentially, we are done with my presentation. Anyway, on a light touch, I also want to take this opportunity to appreciate the previous two presenters that have come just immediately before me. I think Catherine and Raymond. They provide a very good they provide a very good segue to this presentation that I want to make at this point in time. Catherine mentioned the element of, amongst others, the element of networking, avoiding top-down engagements, including voices from the community into the decision-making and decisions. And Raymond has also talked about the element of indigenous knowledge and integrating local perspectives into research. He's talked about collaborating, collaborating with the indigenous communities and local, getting the local perspectives. He's talked about putting people and the community at the center of discussions, and also the element of co-producing knowledge. Amazing discussions, and a good segue to what I want to discuss, essentially looking at translating research to inform policy. And I would wish to share some AfroHoon and AfroHoon Kenya experiences. So for those who are not aware, AfroHoon, or those who may not know, AfroHoon is an inter-university network that seeks to collaborate, seeks to enhance efforts of universities to build a One Health workforce with the transformative skills and mindsets, attitudes and habits to implement global frameworks. And some of these global frameworks include the Sustainable Development Goals. Some other global frameworks includes the JEE. This is the Joint External Evaluation Framework for the International Health Regulations. Others are the PVS, which is the Performance for Veterinary Standards, amongst others. And this is a One Health workforce. In addition to having the skills, knowledge, attitudes, and practices and habits to implement these global frameworks, we are looking at building the capacities of a One Health workforce that also will be able to work across disciplines and sectors. So essentially, that is what we are looking at as AfroHoon and AfroHoon Network. So AfroHoon is based or has a footprint currently in 10 countries, and this is growing. And in Kenya, we are based at the University of Nairobi and Moi University, and still growing. We have engagements with very many other universities in the country. So that is a brief overview of who we are as AfroHoon and AfroHoon Kenya. So I wish to share with you our experiences on how we've been able to deal with this element of translating research to inform policy or to inform action. And the outline of my presentation is that we are going to look at a brief introduction. We'll look at some gaps in translating research into actionable policies and interventions. And then we'll also look at the pathways for translating research into actionable policies and interventions. And we'll have a one-line conclusion. And then, of course, the moderators will usher us into the next session. All right. So this is going to be a very brief presentation. So we've had these statements. I think all of us in this meeting have had, in this conference, have had these two statements, concluding some certain study. All of us have probably written these two statements, that the findings of this study will be critical in informing policy, or this study will provide a basis for further research. We've all either heard about this, come across these statements, or written them ourselves in our studies. And In most situations than not, unfortunately, these statements rarely go beyond their statements that the findings of the study will be critical in informing policy. They rarely go beyond being a statement in the documents that we submit or the presentations that we make. Now, we know that the output of research is used in various ways, or we should know that the output of research is used in various ways. So probably the fact that the statements do not go beyond that, or the research then is not translated, then it means we probably did not understand the various ways that the output of the research we're putting out there, or the research that we're doing, would be used. The research output then should therefore consider the use. When we're undertaking the research and generating the output that we have from the research, we should therefore be considering the use. And this requires a multifaceted approach for us to be able to translate the research outputs into actionable policies or actionable interventions, then requires a multifaceted approach. And I've just indicated here that then these discussions at this conference are therefore timely and appropriate. And we hope then that we're going to be able to learn from each other during this particular conference. So that's a brief introduction, or the brief introduction that I had. The next thing that I want us to look at are the gaps that are there in translating research into actionable policies and interventions. And I have listed like, these are what, seven gaps, and these I want to declare are synthesized from the works by Erisman et al. And Seng 2012, various documents. And so these are thoughts that are synthesized from the works of these different authors that I wish to present here. And so one of the things that has been observed is limitations in current research approaches. And what do we mean here? These limitations are based on the fact that you'll find research being done using a one-way approach, where it is research into practice. We always declare we want to have the research outputs put into practice. But in most situations than not, or rarely do we have the practice being infused into the research, or the practice getting in to inform the research. And so that is a limitation that has been documented, where you have the current research approaches being one way, meaning you have only the outlook of informing practice from research and not vice versa, practice informing research. Secondly, it would be language and communication barriers. Now, scientists have been accused in most situations of not knowing how to communicate the science to the public, or to policymakers, or to opinion leaders, or to users of the intended users of the information. So you're having language and communication barriers taking place, or being a gap in translating research into actionable policies. I'm looking at a situation where a research has been done, and you want to communicate the fact that we have greenhouse gas emissions that cause global warming. And so it is an issue that policymakers need to take into consideration. And the language that is being used is, for example, a certain gas has this percentage of global warming potential, GWP, affecting, influencing global warming. And then we need to take into consideration, we need to have risk, climate mitigation and adaptation, which is causing changes in weather patterns, the ENSO systems. And what you have are policymakers or the general public just looking at you as a science communicator and wondering, what has this person just talked about? What is GWP? What is GHG? What is ENSO? What is La Nina? I mean, you're having language and communication barriers taking place in communicating the science to the policymakers or to the intended users of the research outputs. Then you have challenges in identifying specific decision makers. So in research, we're always talking about we're always talking about having policy makers, using broad-based languages in the research that we are undertaking. While the research is context specific, the intended use is context specific, but then we can't quite get down to identifying who is going to engage with this particular research, or who's supposed to implement the actions that we intend implemented from the research outputs that we will generate. Another gap is a disconnect in the focus. So you have the policymakers, you have the opinion leaders, you have the implementers having a different focus from the researchers. You have researchers coming in and having their own focus and having their own attention and having their own research question and research interest that is different from, like what Raymond has just mentioned, the previous speaker, the local perspective or the indigenous knowledge. And so you get that disconnect. And we've seen, we actually saw one of those issues, well, actually this issue coming up in one of the, an activity that was being implemented in one of our partner countries, where the team that went to undertake a study or to undertake an activity went with knowledge from a desktop review, yet the local community actually didn't think that was a problem for them. They were actually identifying other issues that needed interventions, and yet the researchers were coming in to solve something else. So you get a disconnect in that, in translating that research into action or into policy because of that disconnect in the focus. Then there is also time constraints for research findings translation, translating research into findings. Translating the research findings into actions and interventions for the different stakeholders. Now, we've just talked about challenge number 3 being the challenge of identifying specific decision makers. So now, if you're able to do that, now you can imagine translating the research outputs in a language that is suitable for the different audiences of that output. You have policymakers, assuming you're looking at the 3 levels of an organization: leadership and management. You have strategic, you have tactical, and you have operational. And so if you're translating this research output for the 3 levels, because each would demand a different language, then that would definitely take time on the part of the researcher. That would definitely take time on the part of the researcher, because it is this researcher who's supposed to now package this and disseminate it appropriately to these different audiences. So that time constraint is actually a gap that then hinders the translating of research into actionable policies and interventions, because then the findings are just disseminated as, this is the research that we did, and these are the findings, we had these percentages, these are the actions, and so on and so forth. Then another gap is the research scale and context. You find it becomes a bit challenging to translate, to scale up the research, nationally or regionally. Research that has been done in a context-specific situation, then scaling that up to a national level or a regional level becomes an issue. Yeah, so that research scale and context also sort of becomes a hindrance into translating this research into policies and interventions. Then finally, divergent interests. You have interest from probably the research funding organizations, you have interest from the scientists, you have interest from the policymakers and the governments, you have interest from the local stakeholders, all having divergent, all coming in with their own interests, which are all divergent, with their own expectations. Now merging this becomes an issue. And when the research is done, if all these needs are not met, then it becomes a problem, eventually translating it into into policies that would be relevant for implementation, or into interventions that the local communities would be able then to implement. So these are some of the gaps that that we've been we've been able to identify. Sorry, let me just. I hope my screen is still visible. I believe it still is. Yes. Okay, so these are some of the gaps that we've been able to identify that I just wanted to share with us. Yeah, there we go. I don't know whether it's visible. Sorry, my apologies. Let me just adjust my screen. All right, there you go. Yes. And so now we now want to address the pathways that can actually help us get our research into action. What are the pathways that can get our research? Then, knowing this, how can we then get our research translated into action and interventions, actionable policies and interventions? So that's what we want to look at next. So I will share, my next slide is going to be a fully loaded slide that I'm trying to move. Sorry, my apologies. I want to share with you my next slide, which is a fully loaded slide. Yeah. Is it not moving? Yeah, there we are. Okay, so now this is a fully loaded slide from my end. Because in this one slide, we have several pathways for translating research into actionable policies and interventions. And I will be sharing examples of what we've been able to do and achieve as AfroHoon and AfroHoon Kenya based on these policies. So the first pathway that I want to share to discuss with you is, let me see what is happening with this thing. Sorry. My apologies. Is conducting community research based on conducting community-based participatory research. So this slide explains a lot of these pathways. One, conducting community-based participatory research. Now, this helps us improve the quality of research. It provides an opportunity for us to test what works, about the programs that we're implementing. It also provides an opportunity for us to strengthen the relationship with the community, with the local community. And it provides us an opportunity to understand factors that contribute particular occurrences, and then using these findings to develop a program that improves the desired outcomes, and then testing the implementation of that program. So here you can see on the left, we have the researchers, we have the trainees, we have the communities coming in. So now this is a model that AfroHoon utilizes in one of its initiatives and programs, where you bring on board researchers, you bring on board trainees, you engage them in action learning, you engage them in knowledge co-creation, you have them doing action research and community engagement. And then you have all that information packaged appropriately, synthesized and disseminated appropriately. So now that is a fully loaded model that gives us a very good pathway of translating research into actionable policies and interventions. Like I said, conducting community-based participatory research and eventually translating all that into programs that improve the desired outcomes, and then testing and implementing these programs. So for us in AfroHoon, we've done this through what we call a program that we call the Transdisciplinary Action, Transition Award Multidisciplinary Action Research, where you have research that is action-oriented from the get-go. And then after that research, we also have another program that is called the Mentored Experiential Learning and Training Program. Now, the Mentored Experiential Learning and Training Program was informed by a research or a study that was done using a training needs assessment. Now, this was done across the 10 countries, actually across the 9 countries in Africa, where needs were identified from the communities, where each country did an in-depth analysis of the situations. Now, it was, of course, focused on priority zoonotic diseases, but then we had, an assessment per each country. Then that was also synthesized regionally for the continent. Now, the findings of that were then used to develop a program, a training program, which was, again, rolled out for the continent, across the entire continent. I think we had like 2,000 applicants for this particular training program. Now that training program then was, the participants were then taken through the training, which was done in 3 phases. It's still continuing. We had a didactic phase. We had a field training phase, which is called now the Mentored Experiential and Learning Training Program, where now the participants go to the field, interact with experts in the field, conduct studies together with the experts in the field and the local communities, co-identify challenges together with the communities, co-create interventions together with the communities, and then disseminate their thoughts back to the stakeholders in the communities, in the presence of policymakers and other stakeholders and partners and so on and so forth. Now, we've seen this work to the point where policymakers actually call for those interventions. Partners pick out these interventions, and that then becomes a very good pathway of translating this research into actionable policies and interventions. Then there is the element of engaging policymakers early in the research process. Again, that comes from that model, where before you start this program, you engage the policymakers. Now, engaging them in the beginning, including in the design and execution of this research projects, helps ensure that the studies address the pressing concerns of the policymakers and ensures that the policymakers' interests and outcomes are taken care of. Now, it also helps in understanding their work and integrating their work into the research. So again, AFRON does this using that mentored experiential learning training program, where before we start, like I've just explained, we went to the policymakers, get their opinions, get their blessings to undertake the studies, get them to come with us, or we engage with them through the entire process. We work through the studies and the interventions and share back to them for them to validate the presentations. Then there is the element of improving communication and dissemination and marketing the research. And one way of doing this is by developing policy briefs in a language that can be a language that is palatable to the policymakers. So now on the right of the screen, you can actually see one of the policy briefs that we produced. And if you if you go to Google Scholar, you'll actually be able to access that paper, the AFROHUN Kenya policy briefs. Again, through a process that involves the policymakers, it involves the decision makers, it involves the implementers in the entire process. You work and walk with them to the point that when you are now presenting the document to them, they are able to actually accept it and are ready to implement it. I'm happy to report that one of the things that was noted in this policy brief when we were with the policymakers was the fact that Kenya does not have a One Health policy, and that came out in this policy brief. And I'm glad to report that in certain discussions in various circles in the country, then that issue has actually come up for consideration. And so that is one way that we are able to translate research into actionable policies and interventions. The other thing, I think...
apologies.
Sorry, how many minutes?
Apologies for interrupting you. We are really running out of time, and there's one more panelist. I don't know if you have another slide, if you can wrap up kindly. I really don't want to stop what you're saying, but the time is not on our side.
Let me do that. Let me wrap up in the next 2 minutes. The next thing would be building collaborative research networks. I think Catherine has mentioned that. And AFROHUN has also been able to do that. If you're able to access, like you can see at the bottom, www.academy.afrohun.org, you'd be able to see the network that you are building, that then we can have people coming in and accessing information and resources, and then being able to work together to translate that knowledge into actionable interventions. I think the next slide that I want to share, which would be my final one, would be innovation, leveraging on technology and innovation. And there is that quote that I like there. That name is very difficult. Innovation is seeing what everybody has seen and thinking what nobody has thought. Now, all those images you can see were from an innovation exercise that we did that was actually trying to address healthcare waste management, and great innovations came up, and we need to consider leveraging technology and innovation. Finally, multi-stakeholder partnerships for SDGs, for Sustainable Development Goals, an important pathway for translating research into actionable policies and interventions. There is no single discipline that can be able to do it alone. That's why we address, for example, in One Health, complex challenges which we call wicked problems. it is important for us to engage in multi-stakeholder partnerships. My concluding slide, there is need for strengthening research, practice, and policy. It is doable through the various pathways that we have identified. Those were just highlights, definitely not exhaustive, but highlights. And I just want to acknowledge USAID and the USG for funding the work that we do as AfroHoon. To the moderators and ARIN Network, thank you for giving me an opportunity to share this little that we have with the conference participants. Thank you.
Great. Thank you so much, Samuel. That is a very timely, very well thought out presentation. I think we don't really always think through where does research end, and I like the way you challenged everyone. Everyone is guilty. Yes, we have wanted to inform policy in one way or another, but if you really ask us in actual sense whether we have, it's very difficult to respond to that question. But I really like the way you have directed us into how we can make this happen, which is very well, and the way AfroHoon is doing, I think we can all follow suit in that. And thank you for sharing your knowledge with us on that. I want to call upon the final panelist, Evert, and I really apologize for the time that we have taken. We have really done not very well in time, and I hope that we can all just spare a couple of minutes to listen to Evert's presentation, which he has very well prepared for us. Evert Mugarura from Uganda. He is coming in to talk about capacity building initiatives, how to design these initiatives to ensure that we develop transdisciplinary research skills among us African researchers and practitioners. So just to introduce Reverend Canon Evert Muragura, who is from the Ugandan Public Health Specialist Association in the Ugandan Christian University. He's very well experienced in public health advocacy with 20 years experience. Evert, I really want to bring you in at this point because I know you have worked extensively in this to bring together initiatives and how to help us as researchers. How can we create more of these initiatives? And I really like the way every panelist is coming in to emphasize what Professor Wright outlined at the beginning, the mechanisms we can do to enhance our participation. Evert, you're free to take the floor and take on the question on the capacity building. If you're with us, Evert.
Thank you, ARIN. And thank you, the whole team at ARIN. Thank you, Anne. Being the last speaker, I think I'll use the least time because we don't have time really on our side. Anna, can you kindly share that if you can? Anne, are you there?
Yes, sorry, Evert. Yes, it's coming up.
Okay.
Go ahead, Evert.
Let me do something. What is happening? Okay. Thank you so much, everyone who is still online. You can see we have 48 people still persisting to the end. I'm Reverend Canon Evert Mugarura. I'm from Uganda. I'm a priest in the Anglican Church of Uganda, but a public health specialist as well. I actually carry three hats. One, I'm a lecturer at Uganda Christian University, and I teach public health. I do research and supervise students of public health. at master's level. I also run an organization for youth, Africa Youth Leadership Development and Health, that is I lead. And I also I'm the Secretary General for Uganda Public Health Specialist Association, but also a priest in the church. And that is also very, very important for me because it puts me right at the center of the community. Next. So I'll be looking at capacity building initiatives, and especially this design that we can use to educate ourselves, to highlight or direct ourselves as a way forward. And then the transdisciplinary research skills, which will be talking to the transdisciplinarity that we have been talking about since the conference began. And lastly, fostering collaboration among sectors. I'll be brief. The slides are many, some of them I will not. These are some of my students I deliberately took to a conference in Uganda on health promotion. And these are MP students as a way of building their capacity and also to help them, to direct them to the communities when they know what is coming from there. Next. Then one of the things that we need to do, and of course, which we have failed several times, when we think of capacity building, is needs assessment. Call it baseline surveys, call it data analysis if it is available to inform policy and interventions. This we have failed so much as Africa, maybe other countries, but in my country, everything that is donor-driven, most times they skip this needs assessment, which is intended to identify stakeholders and beneficiaries. Who are they you are addressing anyway? Conduct formative research so that you can be able to interact and engage these people in a way that will help you. I would call somebody, third party coming to this community to understand what they interface with, and then devise means of how to design programs with them and for them. Analyze existing data and literature. Of course, this one we usually do, although it does not speak to the whole issue of the needs on ground. Then define capacity gaps and priorities. That is after you have done your needs assessment. Next. The second aspect we need to put into consideration when we are trying to ensure that this whole transdisciplinary skills are translated into what we do, especially on health and climate, we need to develop clear and smart objectives and outcomes. Of course, this you can't do unless you have something to inform it. And it has to be aligned to to the needs you have identified as you do, as you did the assessment. Then you define targets in accordance with the objectives, and of course the identified population and participants, and choose suitable capacity building approaches, including training, coaching, and monitoring. Of course, capacity building, the first thing you have to do, and others have already alluded to it, you have to really train, you have to enable people to move from what is known to them into what is probably not known to them in order for them to be part and parcel and on top of their leadership as you engage them. And establish an I would call it a robust M&E framework that informs the M&E plan. Most times, again, we want to do things haphazardly and We can rely on reports, but not until we appreciate the place and importance of M&E that we'll begin to be systematic as we do research, especially at this time when we are trying to link health and climate and the impact that comes out of the two. So monitoring and evaluation should be part and parcel of your design without fail. Then the other and the last one, of course, once you have set everything as defined below, as explained below, I mean before, you now begin to implement. But remember, you have to implement along monitoring and evaluation, because implementation and monitoring and evaluation are part and parcel of each other. You cannot avoid it. So some of the things I want to highlight here quickly is that anything that you are going to implement, especially with the community, because that's where our work is anyway, of course on behalf of the nations, you have to comply with the laws and regulations, either in a country or even global laws and regulations, in order to be relevant to what you are expected of. And then resource allocation and management is one issue that is very, very vital. But of course, we are talking of challenges with resources. And when you look on the opposite side, we are talking about inadequate insufficient resource allocation. Who is supposed to allocate the resource? Of course, resources are scarce, but I guess if we are strategic enough, if we are systematic enough, resources cannot be a problem. Like my predecessor, the speaker before me mentioned that you engage the stakeholders, including the donors, when you are disseminating information that you have generated at community level. That's enough to convince them and also to build trust that you are doing something that probably attracts attention or relevance of their resources. Then risk management and mitigation, of course, again, goes with what I have already explained. You are basing on what you have already discovered as priority needs. And therefore, you put a mechanism for managing the risks, even when you know the risks. I mean, the needs on ground. There is most programs don't survive because we don't plan for the risk management and mitigation. There has to be a plan. Leave alone, I mean, then communication. I always talk about communication in health, but communication in general, which does not have a source and feedback mechanism, cannot be effective communication. Most times we communicate downwards, but we don't listen. We have to have an active listening ability to listen to the communities we work with in order for these many players we are trying to bring on board to be on top of everything that you are trying to do with them. You don't stop at reporting. Of course, reporting is key, but communication is the basis for all that if we have to succeed. Of course, I have already mentioned monitoring and evaluation, and I will not go on that again. Allow me to rush to cultural sensitivity. Insensitivity. This has been talked about over and over again. My brother Raymond mentioned it so much on indigenous knowledge and people and other speakers. Cultural insensitivity, I think, has really made a dent in the way we interact with the communities and the lack of ownership, and therefore the challenges with continuity or sustainability majorly hinges on cultural insensitivity. So we need to take that into consideration at implementation, right from the planning down to implementation level until we even close out this project or program. Lastly, on this slide, data management and privacy concerns. Of course, we have talked about this again in terms of quality of data, in terms of the relevance of data, but the way we manage it will determine whether or not you will remain in business. I think our professor, I don't know if it is, yes, Professor Wright mentioned it, that if you don't guard your data, you can lose it to someone else who did not struggle to get it. So you have to guard it, but of course, have links of opening it up to those parties that are relevantly linked to you in order for them to make use of it, that will again shoot into what you are doing. So transdisciplinary research skills are very clearly spelled out, integrative in nature, and the reason why we talk of integration, interdisciplinary collaboration. If you are looking at organizations as individuals, like health now, the health component has got players, but they are also different. They will first work together, and now imagine you are bringing health practitioners together with social workers. Then you are bringing in other players, and you are expected to forge collaboration. That means that you have to think through it as much as, beyond the interdisciplinary collaboration that we have been working with, or we are used to. And then stakeholder engagement, very important. Systems thinking, we have to think of a system that is complex in nature in order to absorb the complex issues that will come with the transdisciplinary research skills that we are focusing on. Not easy, but it is workable. Co-creation has been talked about. It follows the same route. Communication, I have mentioned it. Adaptability and flexibility. You are doing this intentional intervention, or you are taking this direction aware that you have different players with different intentions, goals, and even values. There has to be a serious way and mechanism for adaptability and flexibility. If you want people to move at the same time very fast, you can't make it. There has to be, you give room for them to adapt, but also you are flexible enough to listen to them and ask them how best they can fit in given their values. I can give an example of me as a priest in the church, working in public health, rubbing shoulders with all civil society organizations on health issues, which are sometimes very, very distanced from the church or faith values. And you have to create an intersection between the two parties. It has been a very, very difficult part for me. And I will not mention some of the most challenging areas, but you can imagine faith and family planning alone. For us, we understand it in the public health, but if you cross to say family planning among young people, adolescents, it becomes contentious. How do you bridge the gap with such players coming together on board? So there has to be that interdisciplinary teams put together, collaborative problem solving, cross-sector partnerships, training and mentorship, project-based learning, and then reflective Do people understand where they are coming from, what they have in terms of strengths and weaknesses? Then you create networking opportunities in order for all these players you are trying to bring on board to begin to see lines of collaboration. Next. Next.
Effort, yeah, kindly try to wrap up as we are really way past the time we were supposed to have, kindly.
I will go straight to the next slide, please. That one I'm not going to talk about. I've already talked about it. Key to all this I have talked about is community engagement, which must be effective. We must build trust and credibility. And that means that when we conduct community assessments and needs analysis, we have to have the community person at the center of everything, establish community advisory boards or committees in the communities, host meetings, focus group discussion, community dialogues and fora in the communities, develop participatory budgeting processes, and that's where we have a problem, a big one, because communities that we work with or claim to be working with, usually when it comes to budgeting, they are not anywhere to be seen. Can we change that kind of face and practice and have them be part of the process of budgeting? And then when they come on board, they know what they are working with, what belongs to them, what belongs to the organization or the stakeholders coming on board. Next. The importance of collaboration has been talked about. I'm not going to talk about it again. Key tips to note: cultural and contextual appropriateness and sensitivity will either fail us or make us succeed when we are bringing on board the different players to work with the communities, because our constituents is definitely in the community. Respect for community and group dynamics is important. Indigenous knowledge, which was explained, spices unique innovations. I want to emphasize unique innovations. What we have most times is the usual kind of approaches which my brother talked about, and you look for something unique about the innovation you are coming up with, and you can't find any because you have not engaged the communities to tell you what they can bring on board to spice what you intend to do with them. And that is embedded in the indigenous knowledge. Local communities are the consultants to all technical consultants on their local issues. If we took that as important, I think we'll be the best implementers ever and researchers. Local communities are the consultants to all of us, even who are here in this conference, because they know their problems better than all of us. And it can only be known to you when you go to them and respect them and tap into what they know and respect what they tell you and design programs based on that experience, lived knowledge, experience, and the knowledge generated at that level. Be patient with them and consistent because sometimes they are slow. Climate and health are intertwined, hence the need to integrate them in all policies across all disciplines in order for us to now begin to sing the song of transdisciplinary approaches, research, and all other related interventions. May God bless you. Next slide, I was on thanking you, IRIN, and everybody who has participated in this conference. I am Reverend Canon Eva Tumugara once again from Uganda.
Thank you, Reverend Everett. And I'm sorry I dropped the slides before you could finish, but I'm really, really, really thankful for you taking time to give us those. I think your presentation was really an overview of what everyone else had alluded to. So I really don't even need to summarize it because you have really hit the key point, the highlight of why we are here, why we are talking about collaboration in the first place, and why we really need to come together, and how you have given us the tips of how we can work together and putting the local communities who are always at the center of the work we do, and how to connect them and ensure even bringing together perspectives, local knowledge here, collaboration, and everything that has been spoken about today. So I thank you for that very well thought out presentation. And I think everyone else who has stuck around even beyond the time that we had, that it's a lot of patience to ask from you. And I don't think I have anything to add other than just to show you the sessions that are outlined for tomorrow so that we prepare. Tomorrow we're going to talk now, because today we're talking about now the collaboration, but tomorrow we'll be looking at funding. Sorry, Everett?
Before you conclude, I wanted to highlight this, that going forward, and as IRIN, looking at health, how I wish that we involve the faith institutions in the whole conversation of what we want to do, because they carry the biggest percentage of the communities that we want to work with, but most times they are left out and only to cause us problems. Once again, God bless you.
Amen. Thank you.
I'm sorry for coming back. I remembered that was important.
No, that is absolutely an important point. And I think I agree with you. There was another work I was doing, and I think that came up. And we need to do this a lot more to involve the faith-based institutions, because they're very much in touch with the people. They connect very well with people. I think that is something that really needed to be said, and thank you for that. Going back to my slide, this is the outlines for tomorrow. We're going to talk about the funding opportunities and just, the side events begin at the same time. So we look forward to seeing you there. And as Anne said on the chat, we're not going to have Q&A, but we can engage beyond here, because I think today's conversation was quite rich. And so far, so good. So let me thank you. Let us end here and see you tomorrow.
Thank you, and bye for now.
Thank you too.
Thank you. Bye.